All right, guys, welcome back to another episode of the Raw Intuition Health Show. We've got an incredible show for you today. Really excited about this one. I've been wanting to have our guest, Dr. Peter Rogers, on for quite a while now. I love everything that he's putting out there, and really he's putting out information that you're not going to find any other plant-based doctor or any doctor out there really sharing. He does it in a way that's entertaining as well as super informative. So I'll give you a little introduction to Dr. Peter Rogers, who's going to be giving us a presentation regarding his new book that I'll share with you here soon. So Dr. Peter Rogers has been a doctor so he's been a doctor for over 30 years, is an expert on weight loss, atherosclerosis, writing, public speaking, and academics. He has proven methods for preventing diabetes, stroke, coronary artery disease, and hypertension. In college, Dr. Rogers was a student athlete of the year at Stanford in 1985 and graduated first in his medical school class. Dr. Rogers now works as a neuroradiologist, but also did a fellowship in imaging-guided surgery or interventional radiology at Harvard. He has written several books about nutrition and study skills, including How to Improve Blood Flow, Hot Topics in Nutrition, Straight A to Stanford and on to Harvard, and How to Raise IQ and Become a Genius, among other books. Dr. Rogers discovered almost all major medical textbooks are 50 to 100 years out of date and often completely wrong. He says the shocking truth is that most medical textbooks are essentially worthless because they don't include nutrition, and most diseases are caused by poor nutrition. So this led him to write, this and many other things, I'm sure, led him to write his new book, Medical Reformation, Vegan Renaissance Bible, The Poor Man's Guide to Health, Nutrition, and Toxicology. So it is a complete honor to be able to introduce you guys to Dr. Peter Rogers. Dr. Rogers, thanks for being here.
Thank you. My pleasure.
Thank you. All right, and it's great to see everybody in the chat already. What's up, JJ, Carl? Great to see you guys here. So be sure to write down your questions for the end of the show because we'll be doing Q&A as usual. And somebody that asks a question in the Q&A session, as always, I'll give away a free ebook. One of my books here, we've got 5-Star Digestion, 5-Star Salad Revolution, and 21-Day Raw Transformation Program. Camera's going crazy there. There we go. All right. So yeah, we're going to just have Dr. Rogers give us a presentation from his new book. And I guess I'll let you take it away, Dr. Rogers.
Okay, well, thanks. All right, I'm going to share my screen then.
Yep. Sounds great.
Okay, share my screen. Oh, I think you got me disabled on screen share at the moment.
Oh, do I? Okay, here, let me. How's that?
Yeah, now it's looking like it's working. All right, and all right, I'll share my desktop, share. And let me actually get my Raw Intuition thing in slideshow.
Cool.
Start from the first slide, and then I got to go to here. Okay, now I hit screen share. And presenting, that's what I want, share. Okay, can you see it now?
Yep, got it.
Yeah, I got there should be the monkey on there. Okay, so We're going to be talking about the Medical Reformation. Here's the book. Okay, we'll start out though, the Lord spoke to the people in parables. So we're going to start out with the parable of the Zookeeper. And here is a happy monkey eating a nice banana. Once upon a time, the zookeeper for the herbivore monkeys went on vacation. A medical doctor agreed to moonlight at the zoo. He figured his experience with talking primates would serve him well. Unbeknownst to the doctor, the new commissary intern had been feeding the monkeys the same diet as the jaguars, known as the jagoff diet. The herbivore monkeys got sick, and they were too tired to climb the plastic trees in their cage. Paradoxically, the female monkeys seemed happier because the male monkeys were no longer trying to mount them. The MD gave them pill after pill, which slowed things down a little bit, but the monkeys kept getting sicker. It took 2 pills to control the monkey's high cholesterol and 3 pills to control the monkey's hypertension. The MD also ordered an endocrine consult for the monkey's worsening diabetes. He figured perhaps a continuous glucose monitor with an insulin pump and some artificial intelligence, auto-programmable, insulin dosing might help. He also wisely consulted the cardiac surgeon to evaluate the monkeys for open heart surgery for their coronary artery disease and a possible, coronary artery bypass graft surgery, a cabbage. The surgeon went through the standard consent for the cabbage with the monkeys: graft occlusion, myocardial infarction, heart attack, chronic arrhythmia, permanent pacemaker, kidney failure, respiratory failure, cognitive impairment, stroke, death, painful death. The monkey was scheduled for the operating room the next day. That morning, the zookeeper returned from vacation. The operation was postponed. The zookeeper put the monkeys on a plant-based diet. The monkeys came off all their pills and made a full recovery. However, the male monkeys started trying again to mount the female monkeys. One of the female monkeys filed a complaint that the zookeeper was a misogynist. The zookeeper got fired. Then all the monkeys died. Okay, so this painting right here is like the greatest painting ever made, the Creation of Man, Creation of Adam by Michelangelo on the Sistine Chapel ceiling. And the reason I show this is I think one of the biggest problems currently in healthcare is the lack of ethics, because you get tons of money if you sell drugs or surgeries. You get next to nothing, if anything, by empowering the patient and educating them. And what I'm basically saying is there's so much money that comes from basically ripping off the patients that unless you have what I would consider a Bible ethics, man is created in the image of God and therefore part divine as well as part beast, but thus entitled to the truth and to the best we can do for him, medicine will never get better, because currently all this high-tech stuff is primarily used to exploit people rather than to help them. Don't get me wrong, it can do a lot of great things, but the overall structure of the system is to empty out the patient's pocket rather than to really help them. Okay, humans are designed to eat plants, and it goes back to the Bible, Genesis 1:29. I've given you every plant yielding seed upon the face of the earth, every tree which has fruit, it shall be food for you. I think this is the best of the Adam and Eve paintings, the one by Rubens there. I like it. Okay, and I actually think that's a secret of being healthy. Kind of live like Adam and Eve, but keep your indoor heating and plumbing. Okay, and then the book's called The Medical Reformation for a reason. It's a little bit about Martin Luther, just the sense of Martin Luther said, a simple peasant with scripture knows more than the Pope without it. And so I would say that when that comes to health is any person who knows nutrition, the plant-based diet can help more patients than the head of internal medicine at Harvard without it. Okay, because that's the species-specific diet that we're designed to run on, and it's not going to work without that. Okay. I like Martin Luther's other quote: I do not accept the authority of popes and councils, for they have contradicted each other. My conscience is captive to the word of God. I cannot and will not recant anything, for to go against conscience is neither right nor safe. Here I stand. I can do no other. So help me God. Amen. Okay, and so that's kind of the point I'm making is if you look at, go ahead, watch some videos of the Ivy League doctors talking about nutrition. You'll laugh. It's a joke. They'll typically, almost every single one I've ever seen recommends the Mediterranean diet. And the Mediterranean diet is what someone says when they don't know what they're talking about, but they want to pretend that they do. It's ridiculous. And that's what I'm saying is any person who studies health, learns about a plant-based diet, learn a little bit about epidemiology, the fact that, plant-based communities are a lot healthier. I actually think it's good to learn a little bit about toxicology as well. And you can do more to cure these chronic diseases. You go to a medical textbook, they never cure hypertension, diabetes, obesity, okay? Plant-based diet community, they cure these diseases all the time. Okay, this is just the book here. And so great internet video channels. I think in a sense, it's a little bit like the vegan renaissance, if you will, that people are providing all this information, just like the painters were trying to produce better paintings. The vegan channels are trying to produce better information videos for the population. It's a good thing. Okay, conventional medicine textbooks, they all say the same thing, by the way. And this is what I mean. Like, how could I so confidently say all the books are a joke? And I'll tell you why. Because they all say the same thing, pretty much every chapter about the chronic diseases, the common chronic diseases. They all say, well, this disease, coronary artery disease, obesity, diabetes, hypertension, cognitive impairment, impotence, autoimmune disease. They say, well, it's associated with aging. We know that for sure. Seems to be partly genetic. We don't really know what causes it, but, you might as well take our pill, try to slow it down, and eventually the pills aren't going to work anymore. Then we'll, provide some surgeries that might help. And that's basically the entire philosophy of conventional medicine for chronic diseases, the common chronic diseases. Match the ill to the pill and send the bill. It's almost like dentistry, drill them, fill them, and bill them, okay? All right, and so basically what does this do? It turns the patient here. I'll take my my hood off here. I had a tonsure haircut like Martin Luther there. Patients taking medications, it turns them into like a cow to be milked every day by the system. Okay, you have to pay for the medicines. The medicines cause side effect. Then you need a new pill for the side effect. You got to keep coming back to get your lab checked, make sure you're not having other complications. So that's the downside of that. And so basically, the two healthiest foods are like your starches and your fruits. They'll fill you up. They're relatively low caloric density, so they stretch your stomach for early satisfaction of hunger, early satiety. And then your intestinal tract has to peel the fiber off before the glucose can be absorbed into the blood. So you get this slow increase in blood glucose that stays normal a prolonged amount of time. If you just drink, sugar water, there's no fiber in it, and you'll tend to spike your blood glucose relatively quickly, and that can sometimes lead to rebound hypoglycemia, whereby the pancreas overcompensates and it'll drive your sugar down too fast, and you can sometimes feel kind of lousy from that. You got to be a little careful with that. Okay, and here's basically the standard life course for Americans. They eat the, the SAD diet, standard American diet, a lot of meat and oils and processed food. And then, by the time they're 50, they're fat and sick. They go to the doctor and it's drug. Drugs don't work so well. And the next thing you know, it's surgery, chop, chop, chop. Bye-bye money, dead prematurely. Plus also, I would think one of the worst things that's seldom talked about is how commonly patients are cognitively impaired. I got internal medicine friends. They tell me that every single one of their patients over 60 is cognitively slow. And, they sort of lost that vitality and zip of life. They're kind of like a cow. Hello, yes, thank you. They're pleasant, but they no longer can sort of think and respond quickly and stuff. And these patients are progressively more hopeless. They never get better. That's like something never even spoken about. Get better? What are you talking about? Everyone knows these diseases are incurable. It's sad. Okay, so basically, the sooner you go plant-based on your diet, the better. You got a chance to just not plug up your arteries. If you don't plug up your arteries, everything works. Everything in the body works a lot better with good blood flow. And what plugs up the arteries? It's especially the high-fat diets. And there's other things that contribute to that as well. The sodium and some of the toxins and stuff. And we'll talk some more about the other things here. I'm going to go a little more detail on the next slide. You get your sunshine for vitamin D. You get your exercise to maintain your muscles. You get your sleep to let your brain clean itself and your immune system functions better in sleep. Maintain your social support system. A lot of times having a strong sense of purpose or religion or whatever it works for you helps you to be more resilient. And so this is all kind of free. That's what's funny about it is the stuff that works the best is free. It comes from your own education and understanding and your efforts. And so a lot of people, they want a quick fix. They want a quick fix with a pill and not have to change anything or a surgery. But the problem is the quick fixes don't really work. This stuff works, but it takes some effort. And like I said, too, I add to this, avoid toxins, be careful about EMF. That's a new thing that's causing problems for people. And so I call this God's way of healing. I call this man's way, expensive, painful, and it doesn't really work too well for most things. Okay, most of the common chronic diseases. So this comes from Dante's Divine Comedy. He starts out by saying, in middle age, I found myself in a dark wood and the path was lost. And that's like a lot of us, we're pretty healthy when we're in our teens and we're with our friends, we're playing sports, we got a lot of time on our hands. And then towards, our 30s or so, we get busy, we get a job, we have to commute a lot, then we have a baby or something at home, we're not sleeping as much as we should, and we're in a hurry all the time eating junk food. All of a sudden we're fat and sick. We're like, hey, what happened? Okay, and then, the question is, how do you respond to that? Turn it around as soon as you can, because the longer you wait, the harder it is to turn around. And the first step most people go is they go to conventional medicine, which they think is the answer. They see these magnificent hospitals. Well, why do you think those hospitals are so big and fancy looking? It's because they're making tons of money, okay? And I joke here, this is Dante as he stands at the gates of hell with Virgil, and the sign above the gates of hell say, abandon hope, all ye who enter. So conventional medicine basically says all the chronic diseases are uncurable, as I was just referring to, coronary artery disease, hypertension, diabetes, impotence, etc., cognitive impairment. Okay, so this is Martin Luther in 1517. He nailed his 95 Theses onto the church door in Wittenberg, and the public came and saw them, and it stirred up a big fuss, and it was printed all around Germany. Okay, so what I decided to do was write 25 Theses. 95 is too much. Okay, even 25 is a lot, but we'll work through them. Okay, so starting out, number one, why do internists treat atherosclerosis with pill? The cure rate for pills is 0%. Okay, 0. When low-fat, you have to take the pills every day the rest of your life. When low-fat vegan diet with no oils has a 99% cure rate, this Esselstyn diet. Esselstyn had 198 patients. This is the Caldwell-Esselstyn book, Prevent and Reverse Heart Disease, 198 patients. One patient who had a recurrent cardiovascular event, he says didn't follow the diet, but he figured he'd publish it anyways that way. 99.4%, no recurrent cardiovascular events. So what I have seen in medicine is that the vast majority of patients, 99.9% of patients, they choose the treatment that has 0% chance of cure, and they refuse the treatment that has 99% chance of cure. Stupid, okay? Just think about that. If you had a choice between something that essentially always works or something that never works, what would you choose? An intelligent person would choose the thing that always works and avoid the thing that doesn't work. It's obvious, but it's not obvious in the medical world. Okay. Cardiologists, why do they treat coronary artery disease with stents, which also has a 0% cure rate? It can save your life during an acute myocardial infarction, but most coronary artery stents are placed when a person just has chronic chest pain, cardiac angina, for relief of, increased exercise tolerance, if you will, due to just a chronic fixed stenosis. They don't change your risk of having a heart attack. They don't make you live longer, okay? Why do surgeons treat coronary artery disease with open heart surgery, which also has a 0% increase in longevity for the treatment of chronic coronary artery disease? Why is that? Again, the 0% option is what is always chosen. Okay, most cardiologists, I used to think when I was young, cardiologists, cardiac surgeons, vascular interventional radiologists, they're the real experts on atherosclerosis. But what I learned is that they're really plumbers. A plumber looks at a blockage in a system and says, well, we could bypass it with a graft, or we could get in there, we could open it up with a stent, but they don't know anything practically about atherosclerosis itself. And the big secret about atherosclerosis, we're not going to get into atherosclerosis pathophysiology here in any significant detail, but here's the point. It's a blood clot. Once you understand it's a blood clot, everything else will make sense when you read about it. And the persons who figured it out were the pathologists, because a pathologist doesn't care what causes atherosclerosis. A pathologist doesn't care how you treat it. If you're a cardiologist, you have to praise stents. If you say stents don't work well, you'll get run out of town. Okay, if you're a cardiac surgeon, you have to say surgery is good. If you don't go along that path, you'll get run out of town. So with a pathologist, they don't have a dog in the fight. They can just tell the truth. Okay. And the real theory that explains atherosclerosis is the atherothrombosis theory. I've been interested in atherosclerosis, gosh, since the 1990s, okay? And I can assure you, atherothrombosis is the all-encompassing theory, largely put forth by Gregory Sloop, that really explains it clearly. And all the other things you've heard about it are subsets of that. And for them not to know this, I say this is like a basketball player knowing not how to dribble. Okay, it's pretty fundamental to understanding atherosclerosis, and they don't know this. They won't know this. You ask any doctor, what is atherosclerosis? They go, well, it's related to cholesterol. Well, we don't really know. Okay, well, here's the book of Sloop, Gregory Sloop, MD. This is the best book on atherosclerosis. If you want to read a book about it, you can read this book. You can watch videos on the internet to learn a lot about it. This guy right here, William Roberts. And this guy's a pathologist. This guy's also a pathologist. He's a cardiac pathologist. He did autopsies on 2,000 consecutive patients who died of myocardial infarction or cardiac arrhythmias due to coronary artery disease, ischemia, lack of oxygen delivery to the tissue. And here's some good quotes from him. He says, whenever you feed a herbivore animals a high-fat diet, they all get atherosclerosis. Okay, that's why I think coronary artery calcium CT is overrated, because if you're eating a high-fat diet, you've got it. You don't need to check. You've got it. So why radiate yourself for something you already know? He says cholesterol is by far the most important risk factor for developing atherosclerosis. Yeah, don't listen to, there's a lot of internets going around saying, oh, cholesterol doesn't matter. It's not true. It's the #1 risk factor for coronary artery disease. There's tons of data supporting that, going all the way back to the 1950s. Ansel Keys. And the reason why is LDL cholesterol makes red blood cells stick together and be predisposed to clot. So that's why it is. Okay, single vessel coronary artery disease is a myth. Okay, that's an important point too, because you'll hear people going for a stent or a bypass saying, well, I just had a blockage in one of my coronaries, but the other two are okay. No, that's BS. It's always diffuse of similar severity in all the arteries. They might not just have seen, it as well on their cardiac cath, arteriogram, the rotating views, the obliques, but it's always the same. It is autopsy. It's always diffuse of similar severity in all three vessels. And a stent can only open up the big outer coronary arteries, the ones that run on the surface of the heart. They're called the epicardial coronary arteries, the big ones, okay? Coronary arteries are about 3 to 4 millimeters in the big segments, but then they got progressively smaller branches, and then they got intramyocardial branches going to the muscle. And stenting and bypass can't do anything for that, okay? So, but, what can do something for that? Diet and pills, but diet works much better than pills, so might as well fix that. Okay, the next thing is, why do doctors treat type 2 diabetes with pills, which have a 0% cure rate, when it can usually be cured with low-fat vegan diet, LFV? How come the average endocrinologist has not read the basic papers? Okay, my goal, I'm especially a brain doctor, okay, so I wanted to understand, why are so many people cognitive impaired? Because the number of cognitive impairments going up, up, up. So I started reading all the biochemistry papers on diabetes to try to really understand it. I wanted to truly understand things. And then I figured, well, once I've read quite a bit, I talked to some internal medicine friends of mine, and I say, who are the best diabetes doctors, out where I live? It's a big town. And they go, talk to these people, okay, these guys. And so I went and met with these endocrinology doctors. These are the ones who train the fellows in a fellowship endocrine program. They are considered the top of the game for expertise in diabetes in conventional medicine. And so I asked them, I go, what do you think of the Sweeney paper? They go, oh, we haven't read that. I go, what do you think of the Hemsworth paper? Oh, we haven't read that. How about the Rabinowitz, the Brownlee, the Shulman paper? Oh, we haven't read that. And I'm like, you guys haven't read the basic papers. This is like my introductory reading, okay? And they're all like, and these are the ones who treat all the patients, train all the fellows. And why is that? Because they know the drugs. They're experts on the drugs, but they don't really care what causes diabetes. They're not interested in that because it doesn't affect their drug prescribing. But if you want to cure it with diet, it's good to know that stuff. Typical American healthcare provider thinks diabetes is a carbohydrate disease, but anyone who's read the papers knows it's primarily caused by high-fat diets. Populations that eat low-fat, plant-based diets, they almost never get type 2 diabetes, virtually never. And this has been known since the 1920s. Conventional medicine is completely ignorant of this and essentially functionally illiterate on the topic of diabetes. And the reason this matters is, what kills people? Most people are dying because of obesity, diabetes, hypertension, and what comes from that. Atherosclerosis, plugging up arteries in their heart, making them sad, plugging up arteries in the Johnson, plugging up arteries in the brain, making them stupid. And we'll talk some more about other things that it does as well. But that's what, if you just told me, a 60-year-old patient, by the way, I'm 60 years old. I have no medical problems. I do not take any pills. But if you tell me, 60-year-old patient, I don't even look in the chart. I automatically assume the patient's overweight, that they're hypertensive, that they've got diabetes, they've got coronary artery disease, they've got cerebral vascular disease, and that they're impotent. Okay, I don't have to look in the chart. I know that's almost always true. Okay, this is a good book on diabetes. He found this guy, Roy Taylor. He put patients on a diet to get them to lose weight. If they lost 30 pounds or more, they were almost always cured of type 2 diabetes within 4 years. These two guys both have diabetes themselves, and they're pretty good at their advice on diabetes. Okay, now, why do doctors treat hypertension with pills that have a 0% cure rate when it can usually be cured with low-fat vegan diet? And how come medical students are not taught that high-fat, high-sodium diets cause hypertension? They really don't know this. If you open up the book, even like a recent edition of a Harvard-based pathophysiology book, it'll say, the vast majority of hypertension is essential. Meaning that we don't know what it causes. It's idiopathic. You know what idiopathic is? It means the doctor's an idiot and the patient's pathetic, okay? So they'll say 95% hypertension, 95%, it's all the books say 95%. They'll say it's essential, so we just take our pills and we'll try to slow it down a little bit, which is nonsense because if you go to a plant-based community, the incidence of hypertension is like next to zero. Okay, if you look in the United States at blacks, okay, walk into any dialysis and you see a whole bunch of relatively young middle-aged blacks on dialysis for kidney failure due to hypertension. All right. Then in 1929, Donaldson paper in the Lancet Journal in Kenya, 1,800 consecutive admissions to the hospital. How many were hypertensive? Zero. When they ate a plant-based diet, they didn't have hypertension. Then the other one that I was sort of taught when I was younger, well, it's because of sodium sensitivity. Okay. And of course, I just believed it. I didn't know any better. Maybe because of the weather, nothing you could do. Yeah, right, fine. There's a guy by the name of Richard Moore. He's the guy who wrote this book right here, Richard Moore. And he studied membrane ion pumps with their relationship to hypertension for his whole career, 50 years, real smart guy. And he said, basically, it's not because of the sodium as much as it is a lack of potassium. He said the hypertensive patients were not necessarily eating that much less, not that much more sodium in quite a few instances, but they were not eating any potassium. P for potassium, P for plants. That's where it comes from. All the good stuff comes from plants. Potassium, it's a vasodilator, opens up the arteries. Magnesium is a vasodilator. Nitrate precursors to make nitric oxide, vasodilators, also the antioxidants. They all come from plants, and you don't get them from animal foods and very little from processed foods. Okay, this is a guy named Walter Kempner. This lady, Barbara Newborg, was a doc who worked with him, and he basically ran the rice diet out of Durham, North Carolina at Duke University back in the 1940s, 50s, 60s, and 70s. He had incredible results. There weren't good medicines then for hypertension, and there wasn't any dialysis initially. And he saved a lot of patients, even, getting their blood pressure down from the 200s. And that were already in kidney failure. A lot of them, he saved them. Some of them he couldn't save, but he saved a lot of patients. So he's pretty famous. And I read his book. I read this book, and I read his own book, and I read some of his research papers. It's pretty impressive stuff. He put him on a low-fat rice diet. White rice has 1% of calories from fat. It was non-organic, Uncle Ben's white rice. It all started with, he had a fat black lady came to him and said, "Oh, can you help me?" And he said, I got to go right now, but eat only rice for the next 2 weeks and come back and see me. She didn't come back for 2 months, and she lost tons of weight. All her numbers were dramatically improved. And he's like, holy crap, this works. And he started reading about all these Asian populations. Gee, they're all skinny. They don't have any diabetes. They're doing something right. What is it? And he had previously studied with Otto Warburg. Otto Warburg was a German biochemist. He won the Nobel Prize in 1931 for discovering the Warburg effect, meaning that if you decrease the oxygen delivery to tissues, you can transform them sometimes into cancer. So 35% or more drop in oxygen delivery to tissue, the cell will sometimes revert to a primitive metabolic pathway running on anaerobic glycolysis and survive on that. Okay, so that's called the Warburg effect for cancer, and it's called the metabolic theory of cancer, and it's really good. It's really interesting. I think that's the main explanation for cancer. Cancer is more complicated than that. The big competing theory is the systematic mutation theory and SMT, and I think it's totally overrated. I think it's largely been disproven by the metabolic theory of cancer research and also by the Genome Atlas project. I don't know, that was around 2010 or something like that. I don't remember the exact year. But that basically showed they couldn't find a systematic pattern of mutations consistent with the idea that, yes, it was being caused by the metabolic theory of cancer. Okay, so anyways, that's the deal on hypertension. Okay, how come surgeons don't know? This is thesis number 6. How come surgeons don't know the most basic stuff like blood flow? I'm not kidding you. I know a lot of surgeons, and I talk to them. They have not been trained in how do you improve blood flow to a wound. And that's really obvious to me. Anything you want to heal, you need more blood flow. They know that. They do know about protein. If you eat a higher protein diet at the time that you have an open wound, that'll help it to heal because you need that extra protein at that time for synthesis. Most of the time, though, I think it's better to keep protein relatively low. But that's one time where it's different. But what I'm trying to say is they're not trained in the fact that sodium is a vasoconstrictor. It narrows the diameter of the artery, so you get less blood flow to a wound. It's not going to heal as fast. Okay? So that's an important thing to know, and they don't know it. They don't know about abdominal pressure syndrome. Okay, so the question is, what does fiber do to your stool? Basically, it attracts water to the stool so that the stool will be softer. When you defecate, it should come out like a cow's patty. Okay, you should have about on average of 2 or 3 bowel movements a day. On a work day, you'll probably have a fewer. Let's say maybe average 2 or 3. On a day off, your whole body's relaxed. You got less stress, your colon's like time to catch up, and you'll probably have about 4 or so, some people 5. That's normal. But what I'm trying to say, people who are eating the SAD diet, they'll often have 1 or 1 every other day bowel movement, and it'll come out like goat pellets, like a Tootsie Roll. That's not good because they're straining every time they defecate. That tightening up of the abdominal muscles to strain at defecation is called the Valsalva maneuver, and it causes back pressure. The guy who figured this out was Dennis Burkitt. And this is called abdominal pressure syndrome. Dennis Burkitt was a surgeon from Ireland, and he was a Christian missionary. He went to Africa. He discovered a pattern of a disease called lymphoma that became Burkitt's lymphoma, and he got put in charge of all the epidemiology of Africa, the whole continent. And he started collecting all this data, and he noticed major patterns of disease. The people eating westernized diets were all constipated and had what is called abdominal pressure syndrome here. Oops, I don't want to lose this slide. I'll have to Okay, I didn't lose it. Okay, great. So the straining at defecation with the Valsalva maneuver to increase abdominal pressure had major consequences. They would get rectal hemorrhoids from that. They'd actually get back pressure of the veins into the scrotum because they come from up here by about the level of the kidney, the gonadal veins, and they would get dilation of the veins in the scrotum. It's called varicocele, and that can cause infertility. So people are surprised at that. Can constipation really cause infertility? Yes, it can. That's why. You heat up the testicles, they don't work so well. Okay, what else? The back pressure causes back pressure in the sigmoid colon, and you can get outpouching of the walls of the sigmoid colon. That's the part of the colon right next to the rectum. And little outpouchings are called diverticulosis. All right. And by itself, diverticulosis is not a big deal. In the United States, patient over 50, I expect to see diverticulosis. Most of them have it. On the other hand, I have a doctor who's a friend from another country where they still eat a lot of fiber diets. And he tells me, we don't see diverticulosis in my country. Okay. Anyways, and the significance of it is sometimes the diverticuli will pop. And when they pop open, they release stool onto the adjacent fat, mesenteric fat of the abdomen, and it becomes inflamed. Itis means inflammation. So you get diverticulitis. Okay. The back pressure has other consequences too. The increased pressure in the abdomen can cause the top of the stomach to bulge into the chest, and that'll cause a hiatal hernia. Hiatus is the opening in the diaphragm, and herniation of stomach up into the chest. And then you get gastric acid refluxing in there, and it causes inflammation. That's called, and you get a change in the lining of the esophagus. It's called Barrett's esophagus. It's an abnormal epithelial cells, and those have a high risk of turning into cancer. So esophageal cancer, you go back in time 30 years ago, was smoker drinker cancer. They're the ones who got it. Nowadays, it's lots of people, especially fat people, from the gastroesophageal reflux. They often call it GERD, gastroesophageal reflux disease. Okay, and then this is often abbreviated HH, hiatal hernia. Okay, what else happens? Because the stool is dry on the right side of the colon, you'll form little stool balls, like little rocks. You can call them a fecalith. Feces and lith means stone. Appendicolith, so a stone in the appendix. It'll block the connection of the appendix with the colon, the cecum here. The bottom part of the colon here is called cecum. The appendix just sticks out below like a pinky finger. And when it obstructs the appendix connection to the cecum, the mucus glands distal to that will continue to secrete, but they can't get their mucus up into the cecum where it's supposed to go. So the appendix will stretch and eventually it'll pop. So plant eaters have much lower risk of appendicitis. Gallstones are primarily cholesterol stones, so associated with high fat diets and high cholesterol. The cholesterol can precipitate in the gallbladder. Another thing too is the straining at the stool with Valsalva maneuver, abdominal pressure, it pushes down into the legs, and you have increased tendency to get varicose veins. So you tell that to women. Women find that interesting. Okay. Inguinal hernia. You get more of a tendency towards inguinal hernia, the bowel pouching out through a weakness in the fascial compartments of the abdomen and the pelvis. You can also get more periumbilical hernias in patients who are eating and having lack of dietary fiber. You're supposed to eat a minimum of 50 grams of fiber per day. Typical Americans only eating about 10. Burkett believes we normally probably ate 100 or more every day. This was a good video, is by Dr. McDougall. It's about red blood cells. They stick together. They call it, the fat causes the red blood cells to stick together. That's called rouleau formation, or blood sludge, stack of coins. And that's why eating a high fat diet makes your blood pressure go up, because you're pumping a thick solution. The reason you have a blood pressure is to pump blood to the top of your brain, your cerebral cortex up there, against gravity. And if your blood is normally like water, pretty easy to pump it. But if your blood is thick, because all the fat stick in the red blood cells together, then you have to pump at a higher pressure to pump a milkshake up to the top of your brain. That's what that's about. This was all about abdominal pressure syndrome as described by Dennis Burkett. Okay, meat has all the bad stuff. It's got all the fat, has no fiber. It has an excessive iron. There's issues with meat protein too. Meat protein is different than plant protein. It has a different amino acid composition. It has a lot more methionine, for example, sulfur-containing amino acids. It has a lot more leucine. It activates mTOR. mTOR is mammalian target of rapamycin. It's like a nutrient-sensing pathway that can sense when it has all of its stuff, all the building blocks to build a building. So like a contractor getting ready to build a building, make sure everything's available. So it's the rate limiting step tends to be is leucine available, the stuff available from meat and the methionine. So when it's got all that, it goes, okay, time to build. What that means is it tells the cell to replicate. A cell can only divide about 70 times. So 70 times, and that's called the Hayflick limit. Hayflick was microbiologist working with human tissue cultures, and he found that, non-stem cells, non-germ cells, sex cells, the regular cells in our body, the vast majority of them can only divide about 70 times. After that, they start to die. The reason is a cell shortens its chromosome every time it divides. There's something at the tip called a telomere, like the tip of a shoelace. And once it shortens beyond the telomere, starts shortening into essential genes that it needs, the cell will become progressively dysfunctional and then die. So the point of the matter is you accelerate aging when you're eating high protein diets, especially these high protein animal diets. Okay, so here's a scoop on what makes blood thick. LDL cholesterol overcomes the zeta potential. So here's a red blood cell. It has a negative charge on its outer surface. That's called a zeta potential. The negative charge comes from things like cholesterol sulfate, heparin sulfate, and sialic acids on the outer surface of a red blood cell. And it's good. So two red blood cells, when they come close to each other, they repel each other by their negative charges. But you can have bridging molecules that will stick them together. So let's say that this is a bridging molecule. It'll stick, my fists are red blood cells. It'll stick them together. And LDL cholesterol is a bridging molecule. So is fibrinogen, which is elevated by psychological stress, a clotting protein. So is IgM. IgM antibodies, it's the acute phase antibody when we have acute infection or some inflammation of some sort. Uric acid is elevated by, if you bolus yourself with high fructose corn syrup, also from eating meat, real high protein food, they'll have a tendency to do that. Elevate uric acid. All these things will be a bridging molecule with positive charge on their outer surface. They'll stick the red blood cells together. So this graph here shows LDL cholesterol versus viscosity. Viscosity is just how thick is the blood. The higher the LDL cholesterol, the higher the blood viscosity. That's why LDL cholesterol is strongly associated when it's elevated with increasing the risk of, coronary artery. So remember I told you atherosclerosis is a blood clot. So things that make red blood cells stick together predispose you to blood clotting. Oh, the other thing I should have put on here would be like LPS, lipopolysaccharide, and LTA, lipoteichoic acid. Those are the bacterial endotoxins. Their effect is a little bit more indirect, but it has the same net result. It makes the blood more predisposed to clotting. And viruses will also make it more predisposed to clotting. Okay, so this is one of the reasons why you want to prevent leaky gut. I'll talk about leaky gut in a moment, because if you got leaky gut, you're getting more of this LPS, LTA in your blood, and you're increasing your risk of clotting. And I think that causes more sickness than is widely recognized. Okay, here's a little more on red blood cells. Here's something you need to know. You're going to remember this the rest of your life. Typical red blood cell is about 7 microns in diameter. Typical capillary is about 5 microns in diameter. So what this means is, in order to pass through the capillary, the red blood cell has to deform itself. It has to fold back on itself a little bit to pass through that capillary. And if you're eating, let's say, the high-fat meal, the fat will start sticking these red blood cells together, and that's called a rouleau formation. It means a stack of coins in French. And now it's like, again, like pushing a milkshake or pushing a submarine sandwich through these capillaries. And so pressure has to go up in order to do it. So now you're going to go down to this whole cascade of events related to hypertension, which is not good. You don't want that. This was some work done by Peter Quo. He was a cardiologist in Pennsylvania back in the 1950s. And he took a bunch of patients with cardiac angina, and he fed them a high-fat meal with saturated fat. And then he checked their lipids in their arm every 30 minutes. And he found that at the times of peak lipemia, highest amounts of fat in the blood, from about 3 hours to about 7 or 8 hours, the patients would get episodes, I'm sorry about it, tap my microphone. They'd get episodes of chest pain from the fat, because it was causing decreased oxygen delivery to their heart muscle. Okay, and then people thought, oh, well, in the 1960s, gee, we know that saturated fat is bad from all the work of Ansel Keys, Peter Quo's paper, but we think unsaturated fat is going to be good, the omega-6 cooking oils. So they thought they would try that, the PUFAs, polyunsaturated fatty acids they're called, but they were even worse. They kept the blood being thick, and they kept prolonged lipemia and worsening chest pain for much longer hours. So that was even worse. Those cooking oils, you should never have oil. I won't have even 1 drop of oil. It's very common. I'll talk to a patient or a friend of mine who I'm trying to coach on nutrition, and they'll tell me, well, I'm cutting down on oil. I'm cutting down on fried food. And I'm like, look, pal, you don't get it. Okay. If you have an alcoholic and you tell them, look, you don't drink anymore. You don't get drunk on the weekend. You don't drink anymore, ever. And if they follow that, they're probably going to get better, have a dramatic improvement. Same thing with a smoker. You tell them you don't smoke on the weekend. You don't smoke anymore. People who say they're cutting down, they just keep doing a little here and there, a little here and there. They usually have crappy outcomes. I've seen a lot of bad outcomes in people who do that. So what I'm trying to say is, I think the way it works with humans is they're programmed to have what I would call social thinking. When in Rome, do as the Romans do, everything in moderation, be reasonable, go with the flow. And I'm going to tell you, that's a bunch of crap. That's for social thinking. Okay, herbivores are designed to sort of think socially, but it don't work well. For health, you should think biblically. Thou shalt not eat oil. Never. Thou shalt not eat animal foods. Okay, that's what leads to dramatic recoveries. Okay, and most people don't age well. I can tell you, most people don't age well. Most people that I run into over 50, over 60, they're pathetic, okay? They're cognitively slow, fat and sick on a bunch of pills, and they never get better. Conventional medicine doesn't cure anybody of these diseases, never. They don't even believe a patient's curable, okay? So that's what the typical person, what happens to them. Most people are real impressed by titles. Well, I'm going to the best endocrinologist, the best cardiologist. Yeah, right. Enjoy your pills, enjoy your poverty. Okay, how come medical schools don't teach nutrition, epidemiology, and toxicology? I call it NET, N-E-T, nutrition, epidemiology, and toxicology. Those are the three most important things. I think medical education is basically a joke. Why do I say that? People say, oh, well, the pre-meds and the doctors, they're smart. Let me tell you something. What do they study in pre-med? Calculus? Okay, calculus has nothing to do with medicine. As soon as I was done with calculus, I've never once ever used that again. How about physics? They take a year of physics. As soon as I was done with physics, I've never, ever used that again. Never, ever, okay? They study organic chemistry for a year. All you need is about maybe a week or two of organic chemistry to learn the functional groups and a few things about it. You don't need to know endless reactions on how to make paint, okay? What I'm trying to tell you is they get a fake education that distracts them from the things that really matter for health: nutrition, epidemiology, and toxicology. I use that stuff all day long, every day, okay? And doctors don't know any of it. And the biochemistry books I read, they routinely recommend putting patients on high-fat diets like the Mediterranean diet. And my joke that's like treating a lung cancer patient with cigarettes. It's like sending a syphilis patient to a brothel for treatment. That's completely stupid. That's what I'm trying to tell you. Conventional medicine is not just wrong, it's stupid. And I say this with a lot of experience. I was first in my med school class, okay? I know the books backwards and forwards, all right? I just tell you that. I know exactly what I'm saying here. I have a ton of experience with this. Okay, and the medical students are taught that it is impossible to ever cure the chronic diseases: hypertension, diabetes, atherosclerosis, autoimmune disease, the things that make everybody sick and kill almost everybody. And this is what I would call intentional, conditioned, learned helplessness. They're essentially almost brainwashed into thinking you can never cure a patient, and everybody just accepts that. And then what happens is doctors, they work so hard with all their tests. Their tests are based on the textbooks, which are all wrong. And then once they graduate, now they're exhausted. They go, well, it's time to have a baby. They get married and they have a kid. They're up late. They're tired from having a kid. They go take a job. At the job, they want to try to become a partner. In order to become a partner, the first couple of years, it means a new person has to work all the crappy shifts. You got to work all the weekends, take all the night call. They're totally exhausted. They don't want to ever open a book. Let's say it's some guy, okay? And then his wife, give him a hard time. You don't care about me. You don't love me. You take me for granted. You never take me anywhere. And he's like, well, sweetheart, I'm trying to make partner at the job. She's like, well, my friend, her husband takes her somewhere. So he goes to a nice place. Let's say they go to Florida or something, some warm place. And then they go to a CME, continuing medical education meeting. First of all, the meeting's sponsored by a drug company, so all the lectures are about drugs. And then he's like, oh, well, I got to take the wife and kids to the beach or to the pool. So they just sign the attendance. They don't actually go to the lectures. And what I'm trying to say is they don't ever learn these things, okay? They don't read. They're too exhausted. They're too tired. The little time they have after they work a long day, they spend it with their family, with their wife and their kids. So they don't ever learn nutrition, epidemiology, and toxicology. And those are the three most important things, okay? And I joke that would be like a basketball player not learning how to dribble. Okay, it's stupid. All right, and then they're trained also that conventional medicine is the gold standard. It's the best that healthcare and medicine can offer. And so what I laugh is the motto of an allopathic school is we're the best. We never cure anybody, but we're the best. We always lose. It'd be like a sports team. Imagine a sports team that would brag that it always loses. It loses every single game. That's what conventional medicine does. We never cure hypertension, diabetes, obesity, atherosclerosis, autoimmune disease. That's like saying we suck, okay? But they say we're the best. There's a contradiction there, okay? All right, this is a very good book on nutrition, The Start Solution. This is a very good book here on weight loss, okay? So those are, in my experience, two of the best books on those subjects. I think the best books on those subjects. Well, one of them. There's a lot. Every book has a nuance to what it covers. And I'm sure your raw intuition books are really good. I'm going to read those. Now that I know you, this is my first time meeting you, I'm going to read them. I'm looking forward to reading them. Okay. Let's see here. Oh, this is something funny. Mitochondrial inhibitors. Mitochondria inhibitors are not in the biochemistry textbooks. I was reading all about excitotoxins in the brain and what happens to the brain. And I know that saturated fat inhibits complex 3, and I'm like, gosh, there's more going on with the mitochondria. I would come across it indirectly when I was reading about heavy metal toxicity. And I'm like, how come, I don't know more about this? I was very into biochemistry when I was young. And so I went back through all my biochemistry books. I own like 7 of them. Okay. I went through all of them, and there was nothing on mitochondrial inhibition. I'm like, other than like research experimental drugs, I'm like, this is BS. There's something wrong here. So then I went into the like PubMed medical literature, and I quickly found like 50 inhibitors of mitochondria. This is a big deal because the main theory of aging is the so-called mitochondrial theory of aging. It's one of the main theories. I think it's actually not that simple. But what I'm trying to say is the medical books that college students, pre-meds, and that physicians are trained on are completely wrong and inadequate and out of date. They're kind of worthless, okay? Whereas you go in and you start reading the papers on mitochondrial inhibitors, you see a lot of common medications that inhibit mitochondria. Statins can inhibit coenzyme Q. Okay, great. Metformin, like most popular diabetes drug, one of the most popular diabetes drugs, it can inhibit complex 1. And so I'm like, that's insane. You want to avoid everything that inhibits your mitochondria because you need energy production. The inner mitochondrial membrane, that's where ATP is primarily made, in your body. So it's like one of the most important things in your whole body. So you don't ever want to inhibit it. Whereas all these common things are inhibiting it. Tylenol, atrazine that's sprayed on all the non-organic corn. Glyphosate is the more proper name, but glyphosate is an easy way to remember it. Inhibits complex 2. This is all bad, okay? All the processed foods got antifungals. They're mold inhibitors because they don't want it to spoil. It'll get sent back to the store. Okay, that's blocking complex 2. All right, let's see, what else? There's a whole bunch of them here, and they're common. A lot of things are real common. Fluoride, they put that in your water, okay? It's a poison, all right? It has a minimal decrease in tooth decay. It has a major worsening of IQ, cognitive function. It makes people stupid and docile. I'm sure that's just a coincidence that something's put into your water to make you stupid and docile. Just a coincidence. They also put aluminum into the water. It's a so-called clarifying agent. It binds things to it, which paradoxically can make the water look more clear, but it also lowers your cognitive function. Just a coincidence that these drugs are making you stupid. They also lower your fertility. So the things put in your water, they make you stupid, they make you docile, and they predispose to increased risk of infertility. Just a coincidence. Somebody's making you stupid, docile, and infertile. Okay, so anyways, the whole point of processed food is to keep them on a shelf life a long time, so they always got these antifungals. And there's a whole bunch of other things in here, and a lot of them are real common. All right, and then here's these organizations that are supposed to be protecting you and helping you, and they're all approving of F- in the water. And so it's like somebody who approves of putting F- in your water, that's going to lower your IQ, increase your risk of cancer, increase your risk of infertility, increase your risk of cognitive impairment and dementia. I don't have a lot of confidence in that and their so-called expertise. Okay, here's a lady, Sari Stanchik, who had multiple sclerosis, and she sort of went down that same path. She's had MS. They told her, look, you're probably going to be dead in about 15 years. Take our pills and hopefully it'll help. And she's like, oh my God, she was all sad. She's kind of like getting ready to, she had to drop out of residency for a while. And then what happened was she started reading the literature herself, and she's like, gee, in studies of identical twins, a lot of times the identical twin doesn't get the disease. So it can't just be genetic. There has to be an environmental component. And gee, these nutritional studies seem to have much better results than the ones with drug-based therapy. And so that's a common thing you'll find out. Medical students, they don't even know what leaky gut is. Leaky gut's the most important mechanism of causing autoimmune diseases. It's not even in the books. They won't know about it. I never knew about it. I never met anybody who knows anything about it in the conventional medical world. Okay, another thing too, let's see, all these fancy places, you're going to see them recommend Mediterranean diet. I actually went to a course, I'm not going to say the university, a real famous medical center recently, and all they did was recommend the Mediterranean diet. It was about obesity and nutrition and stuff. It was totally stupid. And dietitians usually don't know anything about, usually know very little about nutrition. Okay, I used to chat with this dietitian at the Whole Foods store, and I would talk to her, and she's like, oh, well, we learned in school that high fructose corn syrup is okay. I'm like, no, it's not. The training was pretty much of a joke. Okay, I actually know a bunch of dietitians, and some of them are pretty good, but most of them in general don't know much and tend to recommend some version of the Mediterranean diet. Anybody who recommends Mediterranean diet doesn't know what they're talking about. Okay, the Mediterranean diet, I call it the Antichrist of diet because it promises salvation and healing, but it leads people into hell. And the reason I say that is it doesn't forbid anything. It allows cheese, fish, chicken, oils, alcohol, etc. It allows a lot of high-fat foods that I would consider quite unhealthy. Another point is that things that damage the gut barrier often damage the blood-brain barrier, and vice versa. Things that are good for the gut barrier tend to also improve the blood-brain barrier, which is mostly fiber. Eat your fiber, okay, and avoid the things that predispose to leaky gut, which is excessive antibiotics, glyphosate, because it originally was patented as an antibiotic. And this matters because a lot of people have had like a traumatic brain injury, like here's a small intracranial bleed, a left frontal lobe contusion, and they really need to take more time off than they usually do. And the tissue right where the bleed is, often that will die. So that's infarcted dead tissue. But the tissue right around it is called the penumbra. Penumbra means twilight. So it's not really dead, but it's not fully functional either. And what you want to do when you have head trauma or a stroke is to save the penumbra. And the way you save the penumbra is by optimizing all your health habits. And like I'm saying is, neurologists don't know this. I know a bunch of neurologists. I'm friends with a bunch of neurologists. Is that you want to protect the gut barrier because leaky gut and leaky blood-brain barrier tend to go together. So when they get the injury, that'll cause leaky blood-brain barrier simultaneously to be associated with leaky gut barrier. And so you want to make sure you're careful about what you're feeding them. You get more fiber into them because the fiber in the gut is converted to short-chain fatty acids. Short-chain fatty acids are used. I'll show you a slide of it in a minute to maintain the tight junction so the gut doesn't leak. When I say leak, I mean things be absorbed from the intestinal contents into the blood that should not be. Okay, let's see here. Oh, and then psychiatry. Psychiatry is like one of the stupidest fields in medicine. All right, my father was a psychiatrist, and he was a good guy. He did the best he could, and that was kind of early in the game, and people didn't understand back then how bad these drugs were. And I had considered going into psychiatry. I studied it a lot. Trust me, it's a disaster. Almost all the drugs, basically, here's Dr. Bregan. He's probably the greatest psychiatrist who ever lived. And he says that almost all psychiatric drugs basically cause a slowly progressive lobotomy. They cause brain damage. Here's his book, Peter Bregan, Brain Disabling Treatments in Psychiatry, Drugs, Electroshock, and the Psychopharmaceutical Complex. It's a disaster. Okay, here's a lady, Grace Jackson, real smart book, Drug-Induced Dementia. She goes into all kinds of detail about mechanisms of brain damage caused by psychiatric drugs. And I'll just explain a little bit of it. Okay, so here's a normal synapse, let's say for serotonin. By the way, about 90% of your brain neurotransmitters are glutamate. Okay, then about 5% are GABA. Glutamate is the on switch. It activates neurons. GABA is the off switch. It deactivates a neuron. And then there's a couple ones that are sort of in between. These are things like the ones everybody's heard of are the least common ones: serotonin, dopamine, norepinephrine, okay, acetylcholine. Those are all, consider them being about 1%. It depends what area of the brain you're in, but ballpark overall, they're about 1% of brain neurotransmitters. So a neurotransmitter is released from the presynaptic neuron. It's in a synaptic, the neurotransmitters are in a little vesicle. It merges with the plasma membrane of the presynaptic neuron, releases them across the synapse. They bind to a receptor on the postsynaptic neuron, and they induce a response. And then the neurotransmitters, they sort of filter back into the original neuron through these reuptake transporters, okay? And then when you take a drug, the most common drugs these days are SSRIs, serotonin selective reuptake inhibitors, and they will prevent these serotonin neurotransmitter molecules from being reabsorbed in the presynaptic neuron. But here's the problem. In the words of Bregan, he says the brain fights the drug. The brain knows that something has changed, something's wrong. So on a normal cell, you'll have, let's say, a whole bunch of postsynaptic receptors, but after you've been taking the drug, you'll have fewer receptors over there. Originally, let's say you have relatively few reuptake transporters, okay, serotonin reuptake transporters. But on the compensated neuron, you'll have a whole bunch more of these. And the original neuron, you'll have a whole bunch of vesicles storing neurotransmitter. And in the after you've modified it by the drug, you'll have fewer ones. And so SSRIs are also mitochondria inhibitors. They have a lot of toxic side effects. As a matter of fact, I saw a couple papers recommending fluoxetine, that's Prozac, recommending that for treatment for chemotherapy because it's so toxic to cells. I thought that was funny. Okay, so some poor patient, they're not feeling so well. Here, take this pill. Chemotherapy makes you pretty sick. Okay, and what I'm saying is the brain synaptic connections, they're not the typical one-to-one correspondence between the presynaptic, postsynaptic neuron with a single neurotransmitter. It's more like this big symphony. And, you can't modify it that easily with just one drug to affect one neurotransmitter, because there's going to be all these compensatory changes. And the net result is you take a problem that initially was probably easily fixable. Patients used to have much better results with the treatment of their depression in the old days than they do now. Basically, also back when, people were more religious, you had the Bible in school and stuff, the incidence of suicide was next to nothing. But now that the teenagers have all these drugs available and lack of religion, lack of purpose and meaning in their life, they don't have a good philosophical, metaphysical system, incidence of suicide is pretty common. Okay. All right. So here I joke about psychiatry. You got three choices. You can take a chemical lobotomy. You can go for electroshock and an electrical lobotomy, or you can get a surgical lobotomy. They'll put wires into your brain, and the smartest move is usually run for your life. Now, don't get me wrong. There might be some times when a psychiatrist can help a patient. If a patient's having an acute schizophrenic breakdown, maybe they transiently will need a powerful antipsychotic drug just to get them to calm down, and they can work with them, okay? But what I'm saying is a lot of times the problem comes from find out why the patient's behaving that way. What's wrong with it? And don't get me wrong, sometimes you can't figure it out, okay? The old quote, Jonathan Swift, you can't be reasoned out of what you weren't reasoned into. But a lot of times, there is an answer to it if you look at it and you can work through it. Not always, but a lot of times. Okay, why do urologists operate so much on prostate cancer? There's a real strong tendency. People think, oh, I got a cancer in my body. Get it out, get it out. We can do surgery tomorrow. I want it out of my body. They don't understand. It's not that simple, okay? In the Dean Ornish study, he writes about it in this book here, Undo It. He found that patients that had declined invasive treatment, surgery, radiation therapy, for example, and that went on a plant, these are patients with low-grade prostate cancer, went on a plant-based diet and also got some exercise, stress management, they tended to keep their PSA, prostate-specific antigen, that's a blood test that indicates prostate cancer, they tended to keep their PSA stable or reduced, versus the people that just went on with their typical ways, they would have the tendency to their PSA to keep climbing. It's an indicator that the cancer is growing when the PSA goes up in the blood, and they would, almost all of them would have to go on to surgery or radiation therapy. So what I'm saying is, what I do is I wouldn't even check my PSA. I just know my risk is so low because I'm a low-fat vegan that I don't want to know my PSA because there's too much of a risk of a false positive. And then you got to get that real painful biopsy. They put an ultrasound transducer up your butt with big honking needles, like 18 gauge. They do a sextant, upper quadrant ×2, middle quadrant ×2. And then the lower one ×2. Okay, I guess they're not quadrants, but you know what I'm saying. Okay, China study, T. Colin Campbell, he basically found the lower the protein intake, the lower the risk of cancer, and especially the lower, and in particular, he meant the lower the animal protein intake. He recommends 0 animal protein to minimize your risk of cancer. So he said it was just animal protein. He says it's not at all plant protein. That's a little bit of a nuanced subject, though. We don't got time to go into it, but there is some nuance to that. But the bottom line is low protein diets and 0 animal protein diets, based on his research, seem very beneficial to cancer patients. Okay, why do nephrologists know so little about nutrition? Again, it's kind of like the other doctors. They're paid to put people on dialysis, okay? Doctors are paid to sell drugs and sell procedures. They're not paid to teach about nutrition. So it's not rewarded. It's not reimbursed by the insurance company. And I used to think, oh, it's just big pharma. But no, it's not just big pharma. The insurance companies want it this way too, because they must benefit from it financially. And then whoever runs a hospital, any hospital in the Western world, the person running it has to be looking at the budget. Okay, they do open heart surgery, $150,000 is payment, all fees included. Okay, cardiac stent, $30,000, all fees included. You teach them about vegan diet, what do you get? Maybe nothing. If you bring them in for a weekend course, maybe $1,000, $2,000 at the most. So you can see why they could care less about this nutritional stuff. And by the way, I got tons of friends who know I know a lot about nutrition. Never once have they ever invited me to speak in front of a conventional medical group, because they know, even though they come to me for advice about their own problems and they come to me for advice about their family and friends, they would never invite me to speak in front of a conventional group, because I'm basically contradicting the standard mantra of conventional medicine. The more drugs you sell, the more surgeries you sell, the more money you make. You know, the mantra is also, if you cure a patient, you lose a customer. That's why they don't want the patient to get better. This is a good book on minimizing kidney failure. This guy was a patient who figured out how to save himself. And he's a pretty bright guy. He's not, I think he did a good job with this book. It's a little long-winded, but it's good. Okay, now about children. I think this whole thing about giving amphetamines to children for attention deficit is insane. If you look at the long-term outcomes, they're very poor. This guy, Robert Whitaker, wrote a pretty good book where he talks about how lousy the long-term outcomes are for these kids put on these attention deficit meds. If you were on a street corner and you tried to sell an amphetamine to an adult, that would be illegal. So all of a sudden, it's smart to give these things to kids? No, it's stupid. Okay. And where does this come from? It comes from some jerk at Harvard. If you're a professor at an Ivy League school, in order to get published, you got to publish more papers. Okay. In order to do research, you got to get grant money. Well, who's got the money? The big drug companies. So you have to basically, make them happy, promote their product, or you're not going to get grant money, and then you're not going to get promoted. Okay. So the way they make money is selling drugs. So what happens is they will lie to sell their drug. And they publish all these papers saying how wonderful amphetamines are for children. It's insane, okay? And so here's Mark Antony at the funeral oration for Julius Caesar, like the play by Shakespeare of Julius Caesar. And I'm just going to give you a little bit from Mark Antony's speech. Friends, Romans, countrymen, lend me your ears. I come to bury children, not to praise them. The noble psychiatrists have told you that amphetamines are good for children, and psychiatrists are honorable men. You all did love children once, and not without cause. What cause withholds you then to mourn for them? O judgment, thou art fled the brutish beasts, and men have lost their reason. Bear with me. My heart is in the coffin with these children, and I must pause till it come back to me. So what I'm basically saying is, patients are basically poor people. Patient can't do anything for a doctor. All I can do is say thank you. No one really cares about them. I'm just telling you it's the truth, okay? You make big pharma happy, drug company, you get money. You make insurance company happy, you get money. You follow the standard of care and generate a billing code, you get money. You help a patient, you get nothing, okay? So what I'm trying to say is, it's sad, but no one gives a rat's tail about all these kids and all these other patients because they have no money. There's nothing they could do to help a doctor, to help a hospital. And that's why I'm saying you have to have like Bible-based ethics. We are created in the image of God, therefore part divine, therefore special. And the patient is more important than the money. Because until you have that, medicine will always suck. And there's no medical surgical bullshitology that's going to change that. Okay, in high tech, people go, well, they got all the fancy bells and whistles, robotic surgery, CAT scan, MRI. BS. I know all that stuff. Okay. It doesn't make any difference. It's typically used to exploit the patient, and it always will be unless you have that fundamental ethical perspective, which is not present currently. They're taught from college onwards. And what I would call atheistic Darwinism, okay, which basically says man is simply a talking monkey, a primate that is able to speak, okay? He does not have a soul. There's nothing special about him, okay? Monkeys are put in cages. Nobody gives a rat's tail about them, okay? And, to choose atheistic Darwinism, which is now the default setting in the academic, educational, medical system of the United States, is basically to say humans do not have a soul. There's nothing special about them. They deserve no intrinsic rights, and they should just shut up and obey. Okay, that's what it means. That's a fact, okay? All right, now let's talk a little bit. Okay, we talked about pediatric drugs. They give tons of bad drugs to kids. They don't really know what they're doing, in my opinion, most of them. Okay, why do cancer doctors often give chemotherapy even when they know the patient's unlikely to benefit? Because the attitude is basically, look, this patient's already practically dead. We might as well try this chemo, the latest drug in fashion, to see if it works. And so the logic is, like throwing a Hail Mary pass, but the problem is they've only got a couple months left. They would enjoy that time with their family if you just leave them alone. If there's no reason to think the drug is going to help them, it's probably just going to cause a bunch of side effects and make them sicker and potentially die sooner. Okay, but why is it given? It routinely is. Why do so many long-term survivors of cancer say, hey, their secret that they helped them to survive a long time, they went low-fat vegan, slept more, exercised more, and were quite religious. All right, and I'll give you the example of breast cancer, okay? Here's the famous pink ribbon. Whenever a lady gets breast cancer, all her friends, they want to be supportive. They wear a pink ribbon. They go, we're raising money for breast cancer. They just give money to the chemotherapy company. No one empowers them to teach them about how you get better. They should be learning about people like this. Okay, here is this lady here, Janet Murray. She had metastatic breast cancer. She became a low-fat vegan. And she actually wrote a book called Raw Can Cure Cancer. And she's a big proponent of raw foods. And she did something rather incredible. This is her husband. He's also a runner. Here is a map of Australia. They ran around the periphery of Australia. They ran a marathon every day, 26 miles every day for 365 days. And that's the whole perimeter of Australia. And then what they were doing is they were showing off the incredible increase in recovery capacity on somebody who eats a plant-based diet. Okay, and I know she was alive 20-something years after being diagnosed with metastatic breast cancer and basically told she's dead in a couple of months. Okay, and here's another lady. This lady here is Ruth Heidrich, PhD lady, and she was told the same thing. You got metastatic breast cancer, you're dead in a couple months, make a will. All right. And she's like, no, I want to run a marathon. She became a low-fat vegan, and she's still alive. She's like, you know, she got diagnosed at around 42 years of age. I think she's about 87, something like that. She's a really nice lady. Incredible. All right. And so that's what I'm saying. This lady right here is pretty interesting. Her name's Kelly Turner. She wrote a good book called Radical Remission about cancer recovery. She was working at one of these famous East Coast cancer centers, and she came across one of these patients who everybody thought was going to die real fast, and they survived for a couple of years with metastatic cancer. And she's like, what did you do? How did you survive? Did you just get lucky, or did you change your behavior or something? What happened? And so the patient told her the story, and then she wrote it all down, and then she went to talk to the doctors over there, and no one cared. They're like, yeah, whatever, it happens sometimes. Patient got lucky, who cares? And she's like, we should be paying attention to this. So she went and started studying all the case reports of patients who had long-term survivors of metastatic cancer. And then she actually drove around and traveled to their homes for like 100 of them and interviewed them. And then she wrote a radical remission book about what are the things they all do. And most of the time, it's going to come down to these things we talked about. Eat a low-fat vegan diet, get your sleep, get your sunshine, be religious, lower your stress level. That sort of thing. Okay. When you exercise, you get your lymphatics pumping, which moves your white blood cells around your body so they function better. And it's your immune system that protects you from cancer. Okay. And as I've seen other metastatic cancers say to me, you know, look, the main thing that removes cancer cells from your body is your immune system. Okay. So why do I want chemo, which is going to wipe out my immune system? Okay. And don't get me wrong, there's sometimes when chemo can save a patient's life, but it's not all patients. There's a lot of cancers it doesn't work well for, and you should think about that in great detail before you make that decision. Okay, there are some cancers it does work quite well for. Okay, how come ophthalmologists do not recommend low-fat, low-sodium vegan diet for their diabetes and hypertension patients? It's because they don't know. They're ignoramuses, okay? Don't get me wrong. Ophthalmologists, I kind of joke by calling them ignoramuses because they're some of the smartest doctors in terms of ophthalmology is a really profitable medical field. So typically, any student that can get into ophthalmology has to be in the top 10% of their medical school class. But the reason I joke is they're paid to do surgeries, laser retinal surgery, and all this fancy stuff. They're not paid to teach patients about the vegan diet. Kempner had a whole bunch of patients that reversed hypertensive diabetic retinopathy with his low-fat rice diet, okay? And then the women get suckered into so much stupid stuff. Okay, we're just talking about breast cancer. So here's this lady putting deodorant on herself. Look at her armpit. She shaved her armpit. Why do I tell you this? Because your upper outer quadrant of the chest used to be about 30% of breast cancer. Now the upper outer quadrant of the breast is about 60% of breast cancer. So it's doubled since, let's say, the 1920s. And so what's thought to be the reason? Deodorant. You put deodorant in your armpit, what are you doing? It typically has a preservative, parabenzoic acid, which is estrogenic. It typically will have aluminum in it to plug up the sweat pores. Those are both, that's a metalloestrogen. So you're putting estrogenic chemicals that stimulate proliferation of breast ductal cells into the armpit, which has shared lymphatics with the breast. Stupid. And then look how they lie to women. They tell her, look, you should even wear deodorant at night. Let me tell you something. You walk in a room, you say, hey, how you doing? Okay. You don't smell each other's armpits like a dog. I've had about 1 million conversations in my life with guys about women. I never once heard a single guy ever not want a woman because she smelled. Okay. If he wants you, he wants you. And if he doesn't, he doesn't. And, you know, deodorant's not going to change that. Okay. For excreting estrogenic chemicals, well, this is for primarily, we're going to talk about regular estrogen. So there's regular estrogen, which the body makes itself. That's called endogenous, produced by the body itself. Exogenous is something externally that the person's exposed to. So endogenous estrogens, they're conjugated in the liver, meaning that another chemical is added to them, typically a glucuronic acid. That's just, consider it this. It's like a glucose with a carboxylic acid added to it. And that binds to the E for estrogen. It's excreted then into the bile, passes into the intestinal tract, and it goes out through the colon, and we defecate it out of our body. That's how we lower our estrogen level. However, if you eat dietary fiber, there's only 2 types of gut bacteria I think are worth knowing about. There's good gut bacteria, comes from eating fiber, and there's bad gut bacteria, which comes from a lack of dietary fiber. That's the main point. There's more to it than that. There's always more to it, but that's the main point. And so what I'm saying is the bad gut bacteria tend to have more of an enzyme called glucuronidase, and this glucuronidase will cut this bond here. So it'll separate the E for estrogen from the glucuronic acid. Now when the estrogen is free, it'll get reabsorbed into the body. So the person will have higher estrogen levels. And there's a lot of women in the United States, tons of them, real high estrogen levels, both endogenous estrogen levels and these external chemicals. And I know a lot of women that tell me, Doc, every lady in my family had to get a hysterectomy before age 35 because of fibroids. And I'm thinking to myself, you're all a bunch of junk food eaters. you're all a bunch of tap water drinkers that don't have a water filter. So you're going to be taking in more estrogen, first from the cosmetic products you use, like we just talked about, the deodorant. Secondly, because you're drinking tap water, which is full of estrogenic chemicals. They don't remove the estrogenics because it's too expensive. You need a carbon filter. They don't do that. Okay. And then you eat a low fiber diet. So you have this problem right here. So they're estrogen overloaded. Estrogen is a fat storage hormone. It says to the body, look, it's, goes way up in pregnancy. You need to gain some weight because the baby might need that for energy. So it's not a good thing to be overloaded in that. Here is the structure of cholesterol. Estrogen hormones are the native estrogen hormones. They are based on this cholesterol backbone. So they're a steroid hormone. It has 4 rings, A, B, C, and D. And the unique thing about estrogen is it has 3 double bonds in the A ring, which is called an aromatic ring because it smells nice. It's also called benzene. And it has great shelf life stability. Because of these double bonds, they actually move around, and the electrons can run around all 6 carbons. So they're really stable. It can stay on a shelf for 4 years and it won't spoil. So companies love that, a good shelf life stability. And then the hydroxyl group, OH right here, and that is antimicrobial. It kills mold. So it's a perfect preservative. This combination of just the aromatic ring and the hydroxyl group is called a phenol, and it's a great preservative. So they want to put this in everything. Okay, and they can just change one little substituent on the molecule, and you can never ban these chemicals because they can always make little variations on it and just keep staying ahead of whatever ban there is. And so that's why the thing to do is to learn to avoid things. Don't use unnecessary personal care products, rubbing estrogenic preservatives on yourself. I don't even use any laundry detergent because I know there's at least one estrogen in it, if not a couple of them. Okay, how come neurologists put multiple sclerosis patients on these really toxic diets, but they don't use the Roy Swank diet? Roy Swank was this neurologist, originally from Canada, then he went to Oregon. He has the best results by far of anyone in the world for treatment of MS. He has 34-year follow-up where 95% of his early diagnosed and treated MS patients maintain their ADLs, or activities of daily living. That's so much better than anyone else. It's not even funny. Okay, and he did a whole bunch of research on blood flow and autoimmune diseases. That's quite interesting. Let's see what else. How come neurologists, they don't know about toxicology? I know a bunch of them, and they're real smart, they're nice, but it's just not in their field to be trained in toxicology, which I think is ridiculous because the brain, of all the parts of the body, the brain is real vulnerable to toxins. And that's one of the things I actually think is unique about my background. Most of the people, doctors that talk about nutrition come from an internal medicine background. And their definition of healthy means good for the heart. And what they always say is if it's good for the heart, it's good for the brain. And I would say, yeah, that's true. However, the brain is way more fussy. The brain is way more complicated than the heart. And there's a whole bunch of things that don't seem to make a noticeable difference in the heart, but are highly toxic to the brain. So that's why toxicology is a big deal when you're studying the brain. And like I said, here's some major toxins: aluminum in your drinking water, in your deodorant, fluoride in your drinking water. Okay, don't let your kids get dental treatments with fluoride. I think it's stupid. All right, glutamate is a neurotransmitter. And it's excitatory. Like I said, it's about 90% of the neurotransmitters in your brain. And the problem is food companies know that it tastes good and people become addicted to foods that have a lot of glutamate in it. And that's what MSG is all about, monosodium glutamate. But there's also such a thing as manufactured free glutamate. You just take a protein and you chop it up into small little pieces, and then you free up more individual glutamate amino acids. The amino acids are like little beads on a pearl necklace, on a string, on a necklace. And when you cut them out of the necklace, they're free. They call it MSG, manufactured free glutamate. That will have the same effect. Our ancestors worried about starvation, so for them to get a bolus of glutamate from a food was a good thing because they were afraid they're going to starve to death. But in the modern world, there's just tons and tons of it, and that has a neurotoxic effect when it's overdone. Plant foods protect the blood-brain barrier. They do everything. Everything you want comes from eating these healthy plant foods, all right? And it's not just any plant food. So just say you're a vegan doesn't mean you're healthy. You want to be a low-fat vegan who eats whole foods, okay? Let's see. Oh, the basic theory, too, about Alzheimer's is stupid. Alzheimer's is like, everyone's told Alzheimer's is the most common cause of dementia. All the doctors are told that. All the lay press that says that. Me personally, I'm a brain expert. It's a long story, but I'm a very serious brain expert, okay? I think Alzheimer's is a joke. What's the historical finding? The question you ask the patient. There is no diagnostic question. What's the diagnostic finding? You put a stethoscope on them anywhere? You palpate a muscle or something? No, there's no physical exam finding. What's the blood test that can reliably diagnose Alzheimer's? There is no reliable blood test. Okay. What's the imaging test? They'll say, oh, well, atrophy, especially of the parietal lobes and the medial temporal lobe. I hardly ever see that. I see thousands of brains with cognitive impairment. Okay. Then they go, well, what about nuclear medicine tests? You can get some information there, but it's not that useful. It's not that definitive. What about autopsy? Surely you can diagnose it at autopsy. No, it turns out normal people can have the characteristic appearance of Alzheimer's, extracellular senile plaques, intracellular neurofibrillary tangles, whereas demented patients who they think has Alzheimer's clinically will then turn out to not have it. And part of that's, you heard of maybe the Mankato nun study in Minnesota with the nuns that volunteered their brains at death, the Notre Dame nun study. And what they found was they developed what was called the cognitive reserve theory, because some of the nuns who were really bright and who liked reading and writing, they then at their autopsy, had a whole bunch of the pattern characteristic of Alzheimer's. They go, well, they've got cognitive reserve. Because they have more cognitive reserve, they have more knowledge in their brain, they can tolerate a heavier load of these characteristic Alzheimer's lesions. So the point was they're trying to protect the Alzheimer's theory because it doesn't fit the actual clinical data. It's bogus, all right? Here's a guy, Jack Delatorre. He figured out that if you tie off the carotid artery in the neck, which supplies the brain of a mouse, about 2 months later, middle-aged and older mice will become demented. And he came to the conclusion, he did a whole bunch of experiments tying off both sides, one side, other arteries, that it's because they have hypoperfusion, meaning a lack of blood flow to the brain. So that means a lack of oxygen and glucose delivery. And you say to yourself, well, how many people have, a tight narrowing in their carotid? Not that many. But lots of people have overtreated hypertension. Lots of people have aortic regurgitation, aortic stenosis from the valve in the heart, or they'll have atrial fibrillation, getting less blood pumped to the brain, or congestive heart failure, getting less blood pumped to the brain. If you've got a severe hypertension, it'll damage the arteries in the brain and cause atherosclerosis in there. So if the pressure is too high chronically, for a couple of decades, you'll start, damaging those small vessels. If the pressure is too low, like you overtreat their hypertension, you hyperperfuse the brain. I think that's a mouse equivalent, okay? And then there's some data on excitotoxins. This Russell Blaylock book was pretty good on the subject. Martin Paul writes about it, especially in the context of EMF, but I'm actually the person who put it all together and has the overarching theory of what you would call neurovascular uncoupling. You've got a baseline metabolic rate in a neuron, you've got a baseline oxygen glucose level, and they normally should be coupled of the same amount. Every time you take a stimulant, you ramp this up. Stimulants are also vasoconstrictors pretty routinely, so they'll decrease oxygen and glucose delivery. And you keep on piling these on. Aspartame, psychological stress, sleep deprivation, glyphosate, these are all excitotoxin effects. Head trauma is an excitotoxin effect. Glyphosate, like I said, is an excitotoxin effect. And you couple that with high-fat diet, sodium vasoconstriction, you keep on moving the distance farther and farther apart between the metabolic needs of that neuron and the oxygen and glucose being delivered, as well as those mitochondrial inhibitors. They destroy energy production capacity. So that's the equivalent of dropping oxygen and glucose delivery. Then more and more neurons start dying, going into a programmed cell death called apoptosis. And that's actually the Peter Rogers, MD theory of neurovascular uncoupling. It's the best dementia theory. If you study the subject, you'll see it's a big expansion of the calcium hypothesis, but these are the two best theories of dementia. They make sense. And you know what else is good about them? They tell you what to do. Avoid all the excitotoxins. Avoid all the mitochondrial inhibitors. Eat the proper diet, okay? And then your risk of being demented is super low, even if you've got, so-called ApoE risk factors, okay? All right, here's the Delatorre study where he tied off the mouse's artery, and then these are the mouse equivalents, I would call them. In your brain, carotid artery comes up to the brain. These little branches here, lenticular striates, feed the basal ganglia down here. And on top, you often have poor perfusion of this area next to the ventricles and the deep white matter, periventricular deep white matter. And if you overtreat hypertension, too little blood goes there. If you have chronic severe hypertension, it damages the little vessels, so you end up with the same result, poor blood flow here. And you'll often see little silent strokes in these areas. I see a bunch of those every day. But most people that are cognitively impaired, they just have an atrophic brain. Okay, here's my slide for what I was just talking about. Metabolic rate should be paired with glucose and oxygen delivery. Usually it's called OGD, oxygen glucose delivery. As a joke, I just call it GOD for obvious reasons. And there's MR for metabolic rate. And so the wider this gets between the metabolic rate and the glucose oxygen delivery rate, these neurons will start just dying. Going into apoptosis means gradual cell death, where the cell is recycled. The plasma membrane doesn't lyse, so you can't see anything with a microscope. You can't see any other than a fewer numbers of neurons than expected. You can't see anything on a brain MRI. That's unlike a stroke, which is a sudden event, total loss of blood flow. Neurons die, they open up their plasma membrane, their contents are spilled everywhere. You can point right to it. Here's the stroke. Whereas with apoptosis, there's just a slow progressive death, and the whole brain just keeps shrinking. Okay, these two right here, Risa Pretorius is this lady from South Africa, Douglas Kell, he's from England. They did great research on bacteria, leaky gut, bacterial endotoxins predisposing to clotting. It also turns out viral toxins do the same thing. Okay. And I think a lot of people have a problem with this. It's called amyloidogenic blood clotting. And so what can you do to prevent this? Well, you can prevent things that cause leaky gut. That's a big deal. It's a much bigger deal than people realize. And how do you prevent it? The best thing is avoid things that cause it. There's some toxic chemicals, a lot of them in processed food, and you get your fiber. Okay. We're not going to go into all the detail of it. So what does it do? Basically, if you have leaky gut, you're getting these bacterial endotoxins across the intestinal barrier into your blood, like LPS, lipopolysaccharide from gram-negative bacteria. Gram-positive bacteria have an endotoxin called LTA, lipoteichoic acid, and they interact with the blood clotting proteins here, like fibrinogen, and they'll cause the fibrinogen to go from its alpha helix secondary protein shape, which is like a slinky, to flatten out like a deck of cards, and then they'll stack up. And when they stack up and interact together, the bigger a molecule is bound together, the more likely it is to precipitate out a solution. Solution in the body is aqueous solution. So it'll precipitate out a solution, and then the proteins all become dysfunctional, and they'll form clots that are relatively difficult for the body to lyse. So these are more severe clots. And I think a lot of people have this after post-viral problems and from leaky gut, and they're going around plugging up small arteries in their bodies, making them sick and decreasing their function, decreasing cardiac function, decreasing cognitive function. And this is not widely known. So the smart move is avoid anything that'll make this worse. Avoid things that cause leaky gut. Okay. Iron overload can do it too. It's a little bit of a long story, but the gist of it is there's something called ferrous redox cycling. And this is from eating too much meat and too much processed food with iron added to it. People in the United States tend to be quite often iron overloaded. Women start becoming iron overloaded after menopause because they're no longer menstruating. And so they're not excreting, getting that iron off their body. That's also why I think women live longer, because they menstruate. And because of that, they don't become iron overloaded so fast. And that protects them because their hematocrit, their blood count is lower. They have less red blood cells in their blood. They have less hypertension because their blood's thinner. It's more like water. Also, they got more red blood cells that are young, immature, having freshly come out of the bone marrow because of their menstruation, that they had to replace those cells. And when red blood cells are young, they are more flexible. Typical red blood cell lives about 3 months, 120 days, and then they're removed in the spleen. So the women have lower hematocrits, less red blood cells, and the ones they have are more flexible, more readily deformable to pass through a capillary. So that lowers their blood pressure. High blood pressure is the number one risk factor for atherosclerosis, number one risk factor for strokes. So they diminish their risk of that. And it's the number one risk factor for atherosclerosis in the heart, especially in the brain too. So they're protected from that, relatively speaking. Okay, here's my leaky gut slide. So normally the fiber is taken up by the bacteria. They convert it into SCFA, short chain fatty acids, in particular the butyrate. Butyrate is used by the enterocytes. The gut's called the enteric tract, so their cells are called enterocytes. Site means cell. And they make these TJs, tight junctions. So the tight junctions prevent anything from the intestinal tract from getting across into our bodies. All these things listed right here, they all cause leaky gut. If you got like the print screen button on your computer, this will be one of the best slides in this talk. And you could just print screen it and then avoid all these things to avoid leaky gut, especially if that's an active problem for yourself. This predisposes a person to autoimmune disease, increased risk of clotting, and a whole bunch of problems. Okay. And doctors don't even know about this. All right. It's actually well known. There's a ton of papers, but it's not well known in conventional medical circles. Okay. So here's the LPS. Here's the bad bacteria, LPS, lipopolysaccharide endotoxin, gets across the gut barrier because there's a lack of a tight junction. It'll incite inflammatory responses. And then another problem is the lack of the tight junctions, and this will predispose to increased risk of clotting. Big protein chunks can get across this gut barrier. Normally, you should only absorb 3 amino acids at a time. That's called a tripeptide, or smaller, individual amino acid, 2 at a time, dipeptide, or tripeptide. But when you got leaky gut, big chunks of protein can get across that gut barrier, and the immune system has to interact with them, and it interacts with them, and it says, the immune system always asks the first question, are you self or non-self? Do you belong here or not? And the problem with the protein molecules is that they're big enough that the immune system will form a response to them. It'll form an antibody to them, but they're similar enough because they come from an animal to the so-called animal proteins we have in our own body. So the molecular mimicry is to be similar to, and then cross-reactivity means these same antibodies will sometimes then cross-react with our own body. So let's say you eat a hot dog, and they just ground up an animal to make the hot dog, and it had thyroid tissue in the animal. It was just thrown into a blender. Your autoantibodies will make antibodies to that, and they can then cross-react with the patient's own thyroid. So for women, it's pretty common to have hypothyroidism due to Hashimoto's thyroiditis or Graves, thyrotoxicosis. Women get a lot more autoimmune disease. About 80% of autoimmune diseases in women. And I think there's something to do with estrogen. I think estrogen makes the immune system a little bit schizophrenic. And why do I say that? Because when a woman has a baby, she's carrying a baby in her uterus. That's like having a transplant, okay? A lot of, half of that baby, almost half of the baby is from the husband's DNA. So what I'm saying is it makes their immune system behave in a little bit of an unpredictable way. So if they're cranked up on leaky gut and they're estrogen overloaded and they're soaking in all these estrogen chemicals, their immune system's more dysfunctional and they're predisposed to autoimmune diseases. So like if I had an autoimmune disease, I would go right to the slide and avoid every single thing on there. I already do anyways, but it would be especially important to those persons, and that might help. Because if you don't fix the problem yourself like this, they'll put you on some pretty powerful drugs. All right, and they can also cause irritable bowel, Crohn's disease, ulcerative colitis, all this stuff. How come orthopedic doctors know so little about the low-fat vegan diet? It's very helpful for improving blood flow to joints, and also, recovering from obesity and getting skinny again. And without it, they get paid to put in, artificial joints, artificial knees, artificial hips, super common. It also speeds up bone healing. That Ruth Hydrus lady I just showed you earlier, the metastatic breast cancer lady who survived, over like 45 years. She got hit by a car when she was riding her bicycle training for a triathlon, and they told her she'd never walk again. She had a comminuted fracture of her leg, lower extremity. I think it was her tibia. She was better and running again in 6 months. They told her she'd never walk again. And what I'm saying is people who eat a plant-based diet, they have better blood perfusion. They have better nutrients delivery to their tissues. They heal faster. Okay, this is a funny one. This is the women in Africa, the Bantu women. They would typically have 9 kids, eat hardly any calcium, about the equivalent of like 1 little cup a day of their total calcium intake. They don't have any problem with osteoporosis. Meanwhile, the American women think the calcium supplements are going to protect them from osteoporosis. And I laugh because their all-cause mortality was like 2.6 times increased, okay? Osteoporosis is not simply an issue of calcium. Getting some exercise makes a big difference, and we get plenty of calcium. This idea of calcium overload is bogus. It's not reality. We don't have time to get into all the details, but that's just a typical example. It's sort of like the way you win the game of health is you sort of do what Mother Nature designed you to do. You don't win the game of health by trying to trick Mother Nature so much. Oh, this is a ischemic spine. I've written a lot of stuff on spine. I currently have what I think is the best theory for understanding the spinal degenerative disease. Basically, it's primarily ischemic, meaning a lack of blood supply. The disc has an outer part that's called the annulus fibrosus, like a steel-belted radial tire. It has an inner part, nucleus pulposus, is like a jelly donut. And when you have a lack of blood flow, because here's the abdominal aorta, runs right in front of the spine, gives off a branch to the mid-height of the vertebral body, then a twig to the end plate. There's an upper and lower end plate here. They interact with the disc. The disc is alive. It runs on anaerobic glycolysis. It gets glucose by diffusion, okay, and it extrudes its waste products also by diffusion. So if you get a lot of high-fat diets, you get atherosclerosis, posterior wall abdominal aorta, stenosis, and occludes the lumbar artery. Then you get a depletion of oxygen delivery to this disc, and the consequence of that is the disc will fail. The annulus fibrosus will crack, and you'll start getting disc herniations. It'll also dry out. That's called desiccation of a disc. And then when a disc no longer is functional, like this one's all flattened compared to a normal disc up here, it can't support weight and distribute weight evenly like it used to. So the spine will compensate by forming bone spurs that bridge towards each other to fuse the spine. You typically call this disc, diffuse idiopathic skeletal hyperostosis, fusing these levels with this abnormal motion. But as soon as you fuse one level, you get, like, let's say we fuse this level, you'll now at this level get accelerated degeneration because it's having to do a lot of the work that previously was done by the disc in all these segments. And you get like a domino effect whereby this will work its way all the way up the spine. There were some papers in the 1980s about ischemia being associated with degenerative disc disease, but I'm the one who figured out it's not just degenerative disc disease, loss of height in the disc. It's also all of this stuff. Diffuse idiopathic skeletal hyperostosis, the anterior bridging osteophytes, interbody fusion, calcification and fusion across the disc space. This is the posterior longitudinal ligament here. You get ossification of it, OPLL, ossification of the posterior longitudinal ligament. I figured out that this is all connected. I wrote 2 books about this subjects. Okay. And I'm going to tell you something too. They blocked me from publishing my papers. I replied to submit papers to these research journals. They will not publish the papers. And the reason is, if you could tell people they can improve their back pain by improving their diet, that would take money away from the surgeons who make a lot of money doing spine surgery. And there's a lot of other things done for the spine. And don't get me wrong, those things all have their place. But what I'm trying to tell you is the medical journals are largely owned by big companies, okay? And they want to make money, and they don't want stuff being published that is going to potentially be detrimental to their money income source. And unfortunately, that is the norm in medicine. And that's one of the reasons why I write books. That's one of the reasons why I give lectures on the internet, because I'm a little bit pissed off that conventional medicine will not accept any information that's not going to be profitable for it. And, you know, if you have just sort of wimpy, mediocre ideas where you gradually, you know, advance the standard paradigms a millimeter, that's celebrated. Or if you make money for a drug company, that's, you know, celebrated in a big way. But if you have big ideas like me that are paradigm shifts, that's blocked. They don't want that getting around. Okay, as far as being estrogen overloaded, if you just want to read one book, here's the best book, Estrogeneration by this guy, Anthony J. It's a masterpiece, one of the top, I would say, 30 all-time health books. It's really funny and clever. He doesn't know much about nutrition. He's kind of young guy. Young guys a lot of times are real macho, think you got to eat meat to be strong. But he's very good on estrogenic chemical toxicities. I've read a bunch of books on estrogen toxicity. This is by far the best one. It's a masterpiece. And the reason it matters is these women are exposed to all these estrogenic chemicals, and they got breast cancer rates are super high. Okay, so kind of the point of all my theses here is that conventional medicine is not treating the problem. It's just throwing drugs and surgery at people that don't really work. And so people aren't getting better. People have very poor outcomes because there's a tendency to think, whoa, medicine in the Western countries is the best in the world. No, it's not. It's kind of a big joke, quite frankly. Okay, opioids have been pushed. You know, I can remember I used to run a spinal injection clinic, and opioids are pushed so heavily. It's not even funny. And tons of people die from these opioids. I've actually personally known people who've lost family members from opioids. They're very dangerous. I would never take an opioid. Okay, like for example, I went for colonoscopy, and because my mother had died of colon cancer, so I thought I'll go for this. Was many years ago, and I didn't want sedation because that way I could drive myself home. I had a whole bunch of work I wanted to do. So my wife, of course, teases me, "Oh, you didn't get sedation because you enjoyed it." I'm like, "No, okay, I just did it because I'm scared of some of these sedation medications. You know, typically they sedate with an opioid and a benzodiazepine. Opioids like fentanyl, benzodiazepine, something like Versed, and that has that effect on memory. What if it damages my memory? I'm all into having a good memory. Okay, I don't want to risk that. Okay, but like I said, when you do something that I would consider intelligent, you get mocked and teased for it. That's how it kind of works. This is just leukoencephalopathy, destruction of brain tissue due to heroin. Okay, here's Dennis Burkitt. I talked about him earlier with abdominal pressure syndrome, and this is a very nice book about him. I think it's the best book on Dennis Burkitt. This is Lady Ethel Nelson wrote his biography here. It was good. Is how come there's no specialty in medicine and nutritional therapy? And then the obvious reason is because it would be detrimental to the profit of other medical fields. Medicine, you know, revolves around selling drugs. And if you look at the scientific foundation of selling drugs to treat illness, you'll see it's like a house of cards. It's a joke. And I show this picture from Alice in Wonderland through the looking glass, where when she went through the looking glass, the mirror on the other side, things looked quite different, almost the opposite of what they previously thought. So when I was a young guy studying medicine, I was like, wow, you know, this biochemistry book, you know, I was real excited about biochemistry. Biochemistry is the language of God that he uses to write the book of life. I must learn this, okay? Same thing about pathophysiology. I was in awe of these big pathology textbooks, 1,700 pages written in the Ivy League. Now I look at them as comic books, okay? Because now I really know the stuff, and I realize they are not addressing the main issues. And I joke too, here's Alice in Wonderland when she talks to the caterpillar and he's just blowing smoke. He doesn't know what he's talking about, okay? And I can tell you, I sometimes get sent medical students, you know, they're having trouble in school, and their parents will send to me to give them advice to help them do better in school. And I'll notice that typically they'll start out medical school teaching them anatomy, and they'll emphasize the small muscles in the back. And it's a joke. It's minutia. All right. I ran a spinal injection clinic. I used to do everything in the spine, you know, epidural steroids, selective nerve root blocks, transpedicular biopsies, you name it. All right. And what I'm saying is I didn't even know the names of all these little muscles. In the first year medical student, they'll have a test to memorize all these minutia little muscles. They're irrelevant. No one needs to know those. I will bet you spine surgeons don't know the name of all those muscles. So that's what I'm saying is they distract them by teaching them minutia, and they never teach them what really matters: nutrition, epidemiology, toxicology. And the reason they don't do it is there's no money in that. If the doctor is ignorant, then they'll agree to follow the standard of care and prescribe the drugs. It's also true that the patients don't want the vegan diet. I would also say, in my experience, more than 90% of patients will not follow a vegan diet. Maybe it's 95% of them. They don't want to do it. They simply have in their mind's eye, they grew up eating, you know, meat and processed food, and they don't want to change. And, you know, they're real stupid. They'll go for open heart surgery, you name it, these awful, terrible procedures. and risking terrible complications rather than change their diet. And, you know, they're stupid. Okay, I'm sorry. But in my experience, most people choose the wrong thing and they have bad outcomes. That's just a fact. And I also laugh. I'll sometimes get medical students that follow me around for a day. And I always tell them right in the beginning, you're going to learn more hanging around me for a couple hours than you have learned in your last 8 years. And they always laugh like, yeah, right, you're full of crap. And then by the time they're done, they have this like awkward smile on their face because they know I'm right. Okay, we talked about all how, you know, pre-med education, medical education. Then also, why don't doctors read more? Here's the reason. Because there's always some bean counter that's on their case. They must go faster, must go faster. They're always going to be compared to some other group or some other hospital. And what they'll typically say is, look, our average internist is seeing 30 patients a day. How come you're only seeing 15? You're not pulling your weight. You need to start seeing more patients or we're going to have to let you go. And the only way you can go that fast is you have to say, well, here's your labs. Here's the standard of care. Take this pill. I'll see you in 3 months. Okay, you have to do that. Otherwise, you're going to lose your job. You follow the standard of care, you can't be sued. It doesn't matter if the patient died. The patient's kind of irrelevant. It could just be, you know, an artificial intelligence patient. It really doesn't matter. You don't even need to talk to them. You need to address them in any way. Just go, here's the standard of care. Take this pill. It doesn't matter if the standard of care is a piece of crap and doesn't work. You make your money and now you can't be sued even if they die and have a terrible complication. So that's where and then you benefit. Big Pharma's happy, insurance company's happy, the bean counter at your local clinic or hospital is happy. So that's why it always goes that way. And this is the Red Queen telling, you know, Alice, you must go faster, faster. You have to run the same place. And so the doctors are often working very long hours, going fast, fast, fast. They're exhausted, they're stressed out, they're tired. And that's why they don't study. I can tell you most of the doctors I know are functional illiterates. They do not read. I got a few that like to read and I talk to them more often, but most of them I talk to routinely. I know tons of them. I grew up in a family of doctors. I know tons of doctors. I talk to them every day. Most of them don't read anything medical. They're just too tired. The little bit of free time they have, they spend it with their families. Okay, so, and then here's what happens to doctors who don't play ball with Big Pharma. The Queen says, off with their heads. Basically, if you don't play ball with the standard of care and make money for your bean counter at your clinic or hospital, you lose your job. So they have to go along with it. And also, if the patient has a bad outcome and you didn't follow standard of care, you could be sued. Okay, so I joke the American Medical Association should be named AMMA for American Murder for Money Association. Okay, I think that's a joke. It's not as much of a joke as you think. And I also joke, you know, what's the other joke? What's the difference between a doctor and a lawyer? A lawyer will rob you, but a doctor will rob you and kill you. Okay, I'm kind of joking there, but there's truth in it. That's why it's funny. Okay, the standard of care has become don't care. Conventional medicine injures more people than it helps. I know that for a fact because it does so much screening that sucks all these patients into the system who are not really sick, and they end up getting drugs and surgeries that they don't really need. And you can't improve it unless you have Bible ethics. I'm telling you. And here, Ayn Rand is a good quote. I like Ayn Rand. She said, the smallest minority is the individual. Okay, and this was a great book. She wrote this book, The Romantic Manifesto, and it's an awesome book. It's like one of the best art criticism books I've ever read. I read a lot of that kind of stuff. I like that kind of stuff. I love this book here too, by The Art of Literature by Arthur Schopenhauer. And he described religion as being the metaphysics of the people. And the point is, unless you value that individual, like think about a parent and a child. A parent says, I love this child. I'll do whatever I can to help you. And, you know, you're not going to love a patient like you love a child, but you still should be thinking, my patient is the priority. I will do what is right by this person, even if we only make $10 instead of making $10,000. We're going to do right by them. And that's only going to come from religious moral ethics. Nothing else can do it, because look at it right now. If they just go through the standard BS, they make money, they can't get in trouble, everybody's happy with them. They start sitting there chatting, trying to empower a patient, they're going to be behind in all their other work. They're going to have poor numbers for the end of the day. The bean counter is going to be pissed off at them. Then the partners are pissed off at them because now they got to see more patients. They're not going to make it unless they play ball. Okay. These are just some books about it, but this is sort of the most interesting one, I would say, of these. And also what I'm trying to say is it affects an entire society, its ethics. You know, when you've got sort of these loving ethics, man is, you know, high value, you produce beautiful art. If you go into places that have been taken over by what I would call atheistic Darwinism, the default morality of modern society, you end up with these modern art museum, and here they have statues of feces. It's not a joke. The philosophy of a society. Imagine an artist from the Renaissance came to visit the modern world, and he had come from seeing, you know, Michelangelo's Pietà statue, and he comes to a modern art museum and he sees sculpture that are just designed to look like turds. He would say, what is wrong with these people? They are sick in the head. They are scum. Okay, that's what he's going to think. I'm sorry. This is a disgrace. People think it's, oh, that they're real trendy to like this. No, this is an insult to mankind. It's a disgrace. This kind of thing should not even exist. Okay, it's awful, and it affects their literature too. And once you reject God-based, Bible-based worldview, it often leads to just abuse of other people. Okay, I'm not going to go into all the details there. Typical modern building, for example, what do you have? It looks like an animal cage. This is said by Tom Wolfe. He says modern office buildings always look like animal cages, and they have a statue of a turd out in front. This is all garbage. A child could do this, and it's a disgusting insult. Look at a building built with love. There's a lot of detail and stuff that's trying to make it respectful. And so what I'm trying to say is the average modern chump will say, well, I go by science. We don't need religion. We don't need all this ethical BS. I just want the science. What they don't understand is science is bought and paid for, okay? The big companies pay off the science. The scientist is a poor guy who wants to make money. He's got to pay his own bills. And big science, big pharma, big food, whatever, they tell him, look, pal, if you want grant money, you do as you're told, all right? And he has to do as he's told, or he won't get any grant money. He'll lose his job, all right? So that's why most science is fake. It's just paid for. The big companies, they own the journals and they own the scientists, and they get published whatever you want, especially a profitable food. Like, let's say you're talking about coffee. They have to make it look good or they get in trouble. This is showing research, I think it was in psychology or something. They found, and this is on drug discovery. It's the same in all fields. Well, here it is, psychology. 65% of were all wrong. The journal articles in the drug discovery papers, they found 75% of the papers were not true. More than half the papers are not true. And like I said, anytime industry funds something, it's almost always bogus, because all they're trying to do is advertise their product. So to me, the word science in the modern world primarily means advertising. Okay. Here's an interesting thing. There was a couple of articles recently that last year in 2023, more than 10,000 research papers were retracted. And just for perspective, back in like 1999, it was 100 papers had been retracted from the medical literature. 10,000 papers. What that means is there were 10,000 papers where there were major errors. And quite often what it means is dishonesty. They're trying to promote a drug or some other treatment or something, and so they lie. And this is like a new record. That's what I'm trying to tell you. There is almost no ethics in medicine. It's disgusting. It's evil. Dana Farber, big cancer institute, Harvard affiliated, 37 studies, scientific fraud. Another Harvard professor who studies dishonesty accused of falsifying data. It's a joke, okay? There's a lot of reasons why the research coming out of the big name places has become a total joke. It's all based on money, and they're playing all kinds of games. And here's Fyodor Dostoevsky's quote from Brothers Karamazov, one of the greatest novels ever written. He said, if there is no God, then everything is permitted, even cannibalism. And I would tell you that even cannibalism is happening right now. They'll take aborted fetuses, make them into medicine. People eat that. That's cannibalism. You can call it something else. And there's even other instances of it that I'm not going to go into right now. But cannibalism is happening on a routine basis in modern America, and it's just not talked about. Okay. And we're either going to get our acts together and have sort of Bible-based ethics, or we're going to keep on going down this path of things getting worse. And here's what we need to do. We've already gone down this path quite a ways. We need to get back on a positive ethical path, or we're screwed. And there's no high tech can fix that. High tech is used to exploit people, not to help them, more so to exploit them than to help them. And that's not going to change unless the ethics are in the right place. I care about this person. I'm going to do right by them. I don't care if I'm poor. I would rather make, $70,000 a year than make $700,000 by doing the right thing. Okay. You have to have that type of ethics. Okay. Because otherwise there's just too much money to be made by taking advantage of people. I told you about coronary artery stents, $30,000, open heart surgery, $120,000 to $150,000. You think they're going to teach somebody the vegan diet when they got that kind of money coming in? You think the boss of a hospital is going to want people learning the vegan diet and curing themselves when they could be pulling out $30,000, $120,000? No way. Okay. All right, so Martin Luther, he told the Pope to shove it when the Pope told him to recant everything. He burned the papal bulletin, the papal bullet's called. There's a bunch of pictures of it, a pretty famous event in the Reformation. And so I jokingly took the PDR, Physician's Drug Reference or Desk Reference for Drugs, and the DSM Diagnosis Statistic Manual of Psychiatry, and I sent them into the fire. So I thought that was kind of funny. It made me laugh doing it. But what I'm trying to say is, you need to go beyond drug medicine if you ever want to understand what causes diseases and what gives people the best chance of recovery. Like I said, the center of the universe in the eyes of conventional medicine is it all revolves around drugs and surgery, and that tends to lead to health hell. And this is Copernicus, the great Polish astronomer, religious man, sort of like a priest or a deacon, not exactly a regular priest, but he basically recognized the sun was in the center of the world, not the earth. And what I'm trying to say is that flip, that, nutrition, epidemiology, and toxicology are the center of the universe for health. That leads to great outcomes. And anybody can learn this. You don't need to go 12 years for pre-med, med school, and residency to learn this, okay? Whereas the people who've gone the 12 years, they don't know this, and they're rewarded for ignoring it completely. Okay, the way the healthcare system works, the people at the bottom, the poor people without any educational training, they tend to love the patient. They're basically a bunch of people in their family are patients themselves. The doctors tend to be what I would call, in the more educated staff is what I call fintelligence. They know they're one narrow part of it, but they don't know the big picture. Hospital owners, they're just focused on making money. And then there's people above them sometimes who they just crack the whip. Big pharma could care less about patients. It just wants to sell drugs. It routinely sells drugs that really are not ethical, that don't really help the patient. This was kind of funny. This is the old picture of Diogenes in Greece walking around the Lantern trying to find one honest man in Athens. Okay, Voltaire had a good quote. He said, "I want my doctor to believe in God so that he does not rob me." Okay. And then doctors are a little scared to talk. It's dangerous. This is Voltaire quotes again. "It's dangerous to be right when the established are wrong. To announce truths is an infallible method of being persecuted. I am very fond of truth, but not at all of martyrdom. Those who can make you believe absurdities can make you commit atrocities." Okay, and I like this one guy. So he says, the question becomes, well, what do you do? Okay, St. Francis had a vision that he would help to rebuild the church, and the Pope actually simultaneously had a vision that a monk would help to rebuild the church. And he started out in a physical sense, rebuilding this one church, San Damiano, and he did rebuild the church, and it was magnificent. But there's also a saying in the Bible that the first birth is a physical birth, if you will. Like, you're born into the world, so to speak. And the second birth, born again or whatever, is a spiritual birth. There's a lot of things in the Bible that are like that. First physical, second spiritual. And what I'm saying is he then had a more of a spiritual effect that he showed everybody an inspiring example that made them improve their own lives. And so what am I getting at here? We talked about how, the current office buildings are ugly, but if you look at college campuses, so I'm a little changing here to college campuses, a lot of them are going broke because online education is so cheap, and I think more and more colleges are going to go broke. We can make these into nutrition health camps. You need somebody who's got good business sense to run the place, all right? But have the patients come in for a week, for a month, whatever was appropriate, and have them, eat healthy buffet options at a cafeteria. They can exercise by walking around there. They can go to lectures in the lecture halls, and we could really help people. And so if somebody had the business skill, I have like zero business skill. I have very poor social skills, zero marketing skills, but I'm good for the educational stuff. I would love to work at a place like that. I wish it existed. There's not even a nutritional institute that you could go and work to do research. I would love to do that too. I stay in conventional medicine because the money's good. Okay, but I wish I could do something with one of these areas, but there's nothing to do. Okay, and I recommend sort of a Spartan vegan diet. Just, eat starches, fruits, and veggies. The only thing I take is vitamin B12. Get the other psychosocial stuff straight with yourself. And I help one of my viewers, because I got my haircut to look like Martin Luther with a monk tonsure haircut, like a halo around the head. And she sent me this thing. She called it the monk diet. I thought that was kind of funny. That's why I'm wearing this monk costume. I thought that was kind of funny, being like a monk, and then because of the religious connotations of my point I'm making, I'm fine with it. And atherosclerosis is largely reversible. It's not completely reversible. You're not going to reverse the calcifications, probably, even though potentially you can after a long, long, long time. You can reverse the blood clot component, the lipid core component, the necrotic core, and shrink the size of the plaque enough that you get significantly improved flow. Flow is over R to the fourth radius to the fourth diameter of the vessel. Plus, the cells will start functioning again. The endothelial cells will make nitric oxide vasodilators, so flow can markedly improve pretty quickly in a couple of days, and even more so over the time in the course of the next couple of weeks. And there's other benefits from the vegan diet. Here's a picture, the raising of Lazarus, okay? Jesus Christou, helping Lazarus, and he's coming back to life. What I'm saying is a lot of men have seen the Johnson start working a lot better after this. And so I'm going to close this talk with the impotence prayer. Our Father, who art in boner land, solid wood be thy name. Give us this day our daily boner, and forgive us our dietary sins, as we forgive those who misdiet against us. And lead us not into temptation, but deliver us from impotence. Amen. Okay, that's it. Hope it was helpful.
Yes, that was incredible. Thank you so much. Here, there we go. Perfect. Wow, yeah. I mean, truly, every video that I see you on, it's like truly a masterclass in everything that matters. And that's why I love what you teach and how you explain things, and, you know, with your drawings and the way that you know, help people understand it in a way that's retainable and understandable. So yeah, thank you for sharing all of that. My favorite topics are nutrition and toxicology as well, so that's another reason why I'm drawn to your teachings. So yeah, I think anybody that watches this is going to get you know, a huge step forward in reaching, you know, the health that they want, and correcting a lot of these things that you know, people are missing. So thank you.
Well, thank you.
Yes. All right. So there's a lot of people in the comments that are absolutely loving everything that you were sharing. So let's see. We can get into the Q&A session. And by the way, I also love that idea of the changing college campuses into health camps. That's such a great idea. So hopefully there's somebody out there with the knowledge and the means to do that. That would be so cool. All right. So let's get over into the Q&A session here. So we are in front of the blackboard for anybody that wants to put their question out there. I know that we already have quite a few, so let's go back here into the chat. I know one person did ask, can you share what is a typical day of eating for you?
Yeah, I usually now eat what you would call an OMAD diet, you know, one meal a day diet. And the reason I do it is for convenience. If I have a work day, I don't eat anything in the morning because I want to be able to sleep a little bit more. I don't eat anything at lunch because I'm super busy and I want to be able to go home closer to on time. I routinely work late compared to what I'm supposed to go home at. Excuse me. And then when I come home, I just eat one big meal. And then when I have a day off, I'm usually doing some type of intellectual work in the morning, whatever it might be. And you're smartest when you first wake up and get out of bed. So I try to do all my intellectual work as much as I can right when I wake up in the morning. And so I still eat the OMAD diet even on my days off. Sometimes I'll have a late lunch, but I'll typically eat the OMAD. What do I eat for the OMAD diet? I usually will eat a lot of starches. I eat a lot of rice, beans, potatoes, sweet potatoes. I like, if there's other things made for me, fine. You know, I tend to cook the old-fashioned way. I have a woman do it, okay? In the sense that, you know, I'll be a wife, a daughter, or grandma or something, you know, and that's the best. Sometimes I got to cook for myself, which I do, but I'm often pressed for time. And then I like fruits. I think my favorite fruit is blueberries. I think they're very, very healthy. They're not so sweet. You know, I love bananas, but if I'm going to eat something like bananas or watermelon, I feel like I got to brush my teeth afterwards. And don't get me wrong, I love them. I think they're great, but I got to be, you know, take care of my teeth. I always floss at night because when you go to sleep, you have decreased saliva production. So you want to make sure your teeth are clean before you go to bed at night. I also like I typically start with an interdental brush, and then I like kind of do interdental brush, floss, and then interdental brush again because I want my teeth clean before I go to bed at night. I haven't been to a dentist in like over 25 years, well, maybe 30 years, because I had a bad experience at a dentist when I was in my 20s, and I'm like, I don't want this ever again. So I read a ton of stuff on dental health, and basically, if you avoid excessive sweets or at least clean your teeth off right afterwards, and acidic things like soda pop, for example, orange juice is also quite acidic. Then you clean your teeth afterwards, you don't get cavities. So that's what I do as far as that's concerned. What are other things I like to eat? Well, there's other fruits I'll eat, but you know, fruits are great, but the thing about them is they don't tend to store as long. They're a little more expensive. So you got to make a little more effort. You got to go to the grocery store a little more often, probably. If somebody cooks for me, I'll eat them, you know, like there's broccoli or something, or squash, or if there's cauliflower. I like all of those things, but I'm habitually pretty lazy, you know, so I don't spend that much time. I'm usually I work full time as a clinical doctor. I wish I could work part time. I still got one kid in college, one kid in grad school, and I'm paying all their tuitions. So I wish I could work part time. I wish I could do research. That's what I really want to do. But I have to work full time clinically. And then I enjoy this educational stuff. So, but I don't have much time, you know, between working full time and, you know, doing some of this educational stuff. I really don't got much time left. So that's another reason why I don't do much else. Like, what else do I eat? The only thing I take is vitamin B12 as far as supplements are concerned. And again, if there's other fruits readily available, I'll eat them. I wouldn't eat avocados anymore, though, because they're spraying this stuff on them, this APL stuff, which I think is toxic.
Yeah.
I eat only organic, even though I think you're probably okay with non-organic if you're careful about it. I wouldn't eat anything sprayed with glyphosate, which would be for non-organic. They'll spray that on the onto the oats. They'll spray it onto the beans if it's non-organic. I would never eat soy or you know, GMO soy or corn. I think the stuff they spray in there is pretty toxic. So I'm kind of simple. And some people say, well, it doesn't matter, you know. You don't need that much variety, because there are some people who came out like from the Los Angeles area saying, oh, you need to eat a wider variety, it's so important. I don't think it really matters. Don't get me wrong, I think it's fine if you want to eat a variety, and I think there might be some real tiny health benefits, but it's not necessary. I'm 60, I'm strong in the weight room, I got great concentration, I can concentrate 12 hours in a row, I have no problem with that. And I see all these young people, they're in their 20s, and they'll sometimes say to me, well, you know, we watched your videos, but a lot of them are too long, we just like the shorts. And I'm like, you're 20 years old, okay? Your brain should be fine. They go, we got brain fog. We don't have attention spans. And that's a common thing amongst young people. And I think EMF is part of the problem. I think it's their cultural conditioning is part of the problem. They're so addicted to their cell phones. I think cell phones make people stupid. You shouldn't hold them to your head. You should use a speakerphone. They open up voltage-gated calcium channels in the brain. It's a long story. That's kind of a big topic, but I do think that that's causing cognitive impairment, because some of these people, they're on that cell phone all day long. They're sending, you know, tons and tons of text messages. And it's a long story, but I think they're walking around with earbuds too all the time. I think the earbuds are better than the cell phone holding up to your head, but I still think you don't want to do that all day long. And I see a lot of young people doing it. I had problems with my kids. They used to sleep with their cell phone right next to their head so they can immediately hear it and answer a text message. And I would take it away from them. Then they would go into conniptions. And I had an argument with my wife. I'm like, don't buy the kid a cell phone. My daughter, for example, in junior high, used to read books and talk to me. As soon as my wife bought her a cell phone, she never read another book again, never had a conversation about with me ever again, you know, and it's kind of sad. And so anyways.
Yeah, that all resonates for sure. Judith says, can you explain the lymphatic system?
Yeah. The way I think about lymphatic system is, first of all, you have the arterial vascular system. Your heart pumps blood, it goes into an artery, then it goes through a capillary, and it returns to the heart through a vein. So it's connected to a pump, which is the heart. Your lymphatics are everywhere in your body, but there's no pump. So where does their propulsion come from? It comes from exercise. And so if you exercise, you increase lymphatic flow about 10 to 30 fold. And that makes a big difference. And I actually think that's why a lot of these people who are survivors of metastatic cancers, they exercise a lot. Like I told you about that one lady, you know, Janet Murray, she's running marathons. Ruth Hydrus was doing triathlons. And you don't have to do marathons or triathlons, but you do want to exercise a lot. You should have some type of exercise routine. And people who exercise a lot have lower risk of cancer. They have a much lower risk of dementia. And that, I think, is not widely recognized, because people think of the brain. They go, what's the purpose of the brain? And you're kind of trained from school, you know, memorize stuff and take a test. No, that's not what the brain's about. The purpose, well, first of all, here's a question of Voltaire. Why do animals have brains but plants do not? Because animals move. Okay, the purpose of brain is movement. All right, and then, like, why do humans have brains? So we can walk down a path in a forest or a jungle or a prairie and survive. Okay, that's what your brain's really about. When an animal walks into a new environment, it better figure out that environment very quickly or it will be killed. And so what that means is, as soon as you start exercising, you become a lot more alert. Like I've had many times, I'm reading a book and I'm starting to space out. I forgot what was said in the paragraph. When I get to the bottom of the paragraph, I get up and I start walking and I can read and I understand it very clearly. So what happens is your muscles are activated simultaneously with your brain. And you get something called neurogenesis, where you produce new neurons. Actually, reading and studying something can also lead to neurogenesis, the formation of new neurons. But the way the brain stores information is by associating with what you already know. The knowledge you already have in your head is like a scaffold system, and the new things, you take them and you put them into categories. It's like in your kitchen, the cups go on this shelf, the dishes on this shelf, the silverware over here. And what I'm saying is, with new information, that's how it comes in, and it's all filtered by comparisons and analogies. You store information all over your brain. That is how you process cognitive space. And so what I'm trying to say here is, when you're exercising, you are activating your brain very effectively, and you're sort of, that's what it's made to do. A lot of the brain is use it or lose it. So if you're exercising, staying active, social interaction is also very good for the brain. Positive social interactions, reading or doing anything which cognitively is positive, that's all good for you. I think TV makes you stupid. I wouldn't watch TV, but I do think, any type of reading, social activity, pleasant social conversation, all of those are building new neurons in your brain. To form a new synapse is synaptogenesis. To form a new neuron is neurogenesis. And these types of positive intellectual activities, they all do that, and they keep the brain functioning. So you give your brain good blood supply with a low-fat vegan diet, and you use your brain through exercise and through reading, studying, and conversation, and you'll keep your brain pretty sharp. A lot of people have got sharp brains in their 90s if they have these good habits, and in these healthy communities, they do.
Yeah. And isn't it funny that our school systems are set up the exact opposite of that, right?
School, I've come to the conclusion, school is designed to make people stupid. What they do is they tell the kids, here's a bunch of vocabulary words disconnected to anything, memorize them for the test on Friday, which the kids do, and then they forget all of them. And I believe it's the equivalent of a punishment. That imagine, you ever see the movie Cool Hand Luke, when he tried to escape, so the warden wanted to punish him with Paul Newman. It's a good movie. Anyways, to punish him, he told him, okay, I want you to dig a hole here. And as soon as he digs a hole, he says, okay, now you've got dirt on my land, put that dirt back into the hole. That's kind of what it's like in a school, where you do one after another meaningless activity. The student knows they're going to forget all of it. The teacher knows they're going to forget all of it, but the teacher's kind of conformist and just going by the book. If you asked almost any person, what do you remember from junior high or from high school? Almost every single one's going to tell you almost nothing, except they learned how to type. Maybe typing was a useful skill. And what I'm saying is it's almost like a punishment. And most people never read another book again after freshman year of high school, when they're forced to read a bunch of stuff they're not really ready for. I joke, like Great Expectations by Charles Dickens. No, that's like his worst book ever. It's kind of a miserable book. And they sort of almost are teaching them that life is meaningless, that reading is a painful waste of time. And what I mean by that too is, once they see all these activities, like just answering questions on a Scantron multiple choice test, that's not what real life is like. I can remember back when I was young, it was just starting to fade out. They used to have auto shop where they would learn how to change the oil on a car, how to change the tire, how the engine works. That's pretty useful. And they sort of faded away from all that. And so I think, like, for example, people say, well, mathematics is good. No, I think mathematics is kind of a joke. The reason I say that is because, think about it. How much does anybody, other than some 1 in 20,000 engineers, does anybody use trigonometry, algebra, and calculus?
Yeah.
They waste your time with that when you could be learning how to start a business. You could be learning how to choose a wife or a husband successfully so you don't end up divorced. A lot of stuff that would help you. How to finance a car or a house.
Yeah, exactly. Yeah, it's pretty backwards. And also, I've always found it, the more I read about, the chemical industry, pesticide industry, it's funny how, in the same with the nutrition industry, basically, the way that I see it, the system's basically designed to covertly destroy us slowly. So, the corporations are allowed to basically put anything they want into their products, and they get to be the ones that test them and then tell the regulatory agencies if it's safe. And so then they put it out, and it takes years or decades for the public to catch on that something is wrong. And then they got to do all these test studies and things that can take longer and decades. And then the corporations, they fight it, and they try to discredit the people that are out there warning against these things. And then the regulatory agencies require all this proof, and then the legal battle goes back and forth for decades until they finally say, all right, we'll take it out, and then they put in something the same, or if not worse. And so that's also why I am so, like, I really want people to discover your channel and your message, because the way that you tie in nutrition and toxicology, as well as a lot of the other stuff that you talk about, and the ethics, biblical ethics and Christianity and all these things, and like how this is all kind of tied together. And, things are, if you really look into a lot of this stuff, it's like things look pretty bleak, But do you have hope for, the direction that we're moving?
To me, it's kind of obvious what's happening. All these bad things. I agree with you 100%. But what I've been frustrated and saddened by is most people don't get it. They're like clueless. Yeah. And I'm like, unless the public becomes more aware of these problems, they will never be fixed. What most people do is they kind of trust the regulatory agencies to make things good, to make sure that organic food is good, to make sure food in general is good, et cetera. And the reality is, like you just said, these regulatory agents, they could care less. No one cares about the regular people. You want to call them the proles, you want to call them the peasants. No one gives a rat's tail about them. In my experience, that is completely the case. In fact, a lot of the higher ranking persons in these industries have contempt for the regular people. Okay, I actually think the way processed food is designed in tap water, it's designed to sterilize people and to lower their IQs. Okay, so the benefit is you learn about all these stuff. You can improve your health, the health of your family and friends, and whatever persons, request your advice. But it is kind of sad. I think United States, in my opinion, has turned away from God, if you will. It used to be much more ethical and have that sort of God-based worldview, and that values the individual. Okay, creating the image of God, therefore like to God in some way, part divine. And once you go away from that, the default setting is atheistic Darwinism, which says mankind is just a monkey that talks, a talking primate. He has no soul. There's nothing special about him. And once you start thinking that way, then it becomes exploitive. And that was really pushed by England in the 1800s because they were an imperialistic power. And so they loved Darwin's view of things because they could use that to justify. For example, my father is Irish, okay? And the Irish are almost like slaves to the British for about 1,000 years. And the Irish, and they would just justify it. They always say, well, the Irish people are inferior, therefore they deserve to be controlled by us in England. And so what I'm trying to say is, in a sense, we're seeing that kind of mentality with the rich controlling the poor, saying, look, all these poor people are inferior. They're lucky they get anything. And that's just the way it's going to be. And who cares? Okay. In public, people might say, yeah, I'm doing the right thing. But in private, behind the scenes, what's done is exactly what you said. A bunch of slow poisons in the water, in the food, in the air, and they're never removed, and they're never going to be. So all you can do as an individual is try to learn about them and navigate as best you can.
Yeah. Extropian Transhuman says, should we aim for a biblical diet, eating foods from the Bible to improve our health?
Well, you could. There's such an idea, as I said, Genesis 1:29, that we were all designed to eat plant-based diets. And then after Noah and the flood, the water had, sort of destroyed the plant vegetation, if you will, of the world that was relevant there. And so they said, well, now we have to eat animals. And then I haven't studied the Bible stuff all that much. There's different arguments I've heard back and forth, but the gist of it, I think, is that we're designed to eat the plant foods. We can, in a pinch, eat the animal foods. I think, populations that were in cold winters, help survive that winter by eating, animal foods and dairy. Okay, they were more available in a cold winter. But under ideal circumstances, we run best on plant foods, and that's been proven pretty obviously.
Yeah. Let's see. How do we get medicine back on track now that we know what works and what doesn't work?
Well, like I said, it can only come from that Bible-based worldview. And I don't think it's going to be fixed, because you have to imagine you were making $1 billion a year. And you could care less. You think the proles are a bunch of talking monkeys. You think they care about the talking monkeys? No way. Like, we're getting $1 billion a year. Just shut up and keep on making the money and block anything that'll take away our money. So it's not going to get fixed.
Yeah. Yeah. Moon says, how do you know if you don't have a cavity forming to catch it in the beginning stage without going to the dentist?
Well, that's a little bit of a tough question, because could you have an early cavity that might benefit from treatment? Maybe. I'm not a dental expert, but here's what I do know. If you take good care of your teeth and they're feeling okay right now, I've never had anything progress. I've been doing this over 25 years. And also, like, my wife had a friend who dated a guy whose sister was a dentist, and we all went out together, and she looked at my teeth and said, oh, they're fine. She said she had a little bit of an accident. She said, you will die with these teeth. Okay, so I got no problems. All I do is that, I don't even brush them that often because a lot of the toothpaste I don't like. I don't brush over the amalgams that I do have because I think you can stir up the amalgams, which contain mercury. So if you just take care of them, you're probably okay. Because I worry about going to the dentist. They're going to want to get an X-ray of you. The X-ray machines are a lot better than they are now, but I used to worry about some of the other X-rays. You're going to radiate your skull a little bit, and then I think they can't get paid unless they get an X-ray first.
Right.
Okay, so they're obligated to get that X-ray. And then the other thing is they want that X-ray so they can try to find more cavities, and then they can get more money. The old joke is drill them, fill them, and bill them is the sort of the mantra of dentistry. And so my attitude is like, look, all you got to do is avoid sweets, avoid acidic foods, clean your teeth at night, and you don't have a problem. Why not do that? I like to solve my own problems to the extent that's possible rather than going for solutions to the conventional system, which tends to charge a lot of money and make things worse quite often.
Yeah. Yeah. And I'm the same way. I went to in college, I went to a dentist who told me that I had 6 cavities and I didn't feel them or anything. So I was going through a very stressful time with finals and all these things. I ended up getting like basically what they called trench mouth. I had like all these canker sores like all throughout my mouth. And so I went to the dentist. I don't even remember what they did for that. They gave me something, I think. But the dentist said I had 6 cavities. And so he wanted to do all the work right there that day. And so it was something just seemed a little off. So I went back to my home dentist and he told me I didn't have any cavities at all. And so I never went back to that dentist. I ended up, I drank V8 for like a week straight or something, and then my mouth got better. But obviously my diet was a huge contributor to that, and all the alcohol and all this stuff that, I probably didn't have the greatest college experience like you did in terms of the benefits of learning and all that. I was out partying and all these things. So it wasn't until I got into this lifestyle, eating a whole food plant-based diet, that my mind really opened up enough for me to want to learn. Before I was just into partying and, going to the bars and video games and all these things, and I hated reading. I started eating better. I started getting more fresh fruits and vegetables into my diet. And then I just it became infectious to want to learn more, read books. And so now that's like all that I do. And so, yeah, I think not only is, education set up to make us stupid, but also the diets that we're all fed from the womb, essentially, for most people, as you explain so good, or so well, the things that we're consuming are making us stupid as well, and clogging our arteries and sludging up our blood and all these things. So yeah, I think there's just so much to overcome for people. But the great news is that once you start eating better, it starts to improve so many other things and kind of gets the ball rolling in a good direction.
Yeah, I think the low-fat vegan diet is the most powerful thing in all of health.
Yeah.
Because it's the most easily controllable variable, and it makes such a big difference.
Yeah, for sure. But I was going to say about my teeth. But yeah, I also very rarely go to the dentist. I got my teeth cleaned maybe 5 years ago or something. And that's about it. And I never go, and I've actually never had a cavity in my life. So I thankfully don't have any fillings or anything. So that's one thing I got going for me. But, yeah. All right, let's see. Extropian Transhuman says, I heard greens are supposed to be good for remineralizing the teeth. So if we have any issues, that could help.
I don't know about remineralizing the teeth. They're just good in general.
Sure.
Another thing that's a little bit funny is there's a downside to brushing teeth or using mouthwash. You got bacteria on the back of your tongue that help convert, the plants, like the greens especially, contain nitrates, which is NO3, 3 oxygens. And the bacteria in the back of the tongue converts those to NO2, nitrites. Then they go into the stomach, and the stomach acid helps convert those from nitrites into nitric oxides, from NO2 to NO. And that gets absorbed in your blood, causes systemic vasodilation, something similar to the idea you walk out in the sun, you feel good because you got nitrate precursors in your sub-Q that are activated by the sun, and they go throughout your body, get this vasodilation, good feeling. So what I'm trying to say is you could be making yourself worse by using mouthwashes and toothpastes too much.
Yeah.
and wiping out those bacteria in the back of your tongue, you can increase your risk of hypertension and atherosclerosis from that because you lose that systemic nitric oxide.
Absolutely. All right. Well, I'm not seeing any other questions. There's just a lot of love for Dr. Rogers. The Urban Pharmacy says, OMG, I love Peter. And so many others have said how much they absolutely love what you're doing. So thank you again. And so everybody, I have the link to Dr. Rogers' YouTube channel. I highly recommend going to subscribe to his YouTube channel and share those videos around, because if you enjoyed today's video, you're going to absolutely love everything else he has on his channel, because it's just like this. It goes into so many different topics that are so important to understand that, like I said, hardly anybody else, especially plant-based doctors, nobody else is talking about this. So super important information. And for me, like I said earlier, the way that Dr. Rogers explains things and ties these things together, it's so, he's relatable, but he's obviously like a super genius in my opinion. So, he's doing a great service to the proles and to, society as a whole. And I just thank you so much. So go check out his links, check out his new book. I've got the link to the new book on Amazon in the description box as well. And then, let me quick do the drawing here. I almost forgot. So let's see here. I'm still working on getting that automated name drawer, but we're just gonna scroll through here and see where my mouse lands. All right, and we've got Judith. So Judith, if you have a book of mine that you would like, I'll send you a free copy of the ebook. So just email me at matt@myrawintuition.com and I will get that over to you. And thank you everybody for asking your questions, being here with us, and just wanting to improve your life. And I guarantee you, if you go follow Dr. Rogers, you're going to do that. So, Dr. Rogers, any last words before we sign off?
Well, I hope this was helpful. It sounds like, I enjoyed being on your show, so it's good.
Perfect. All right. Well, thanks so much. I hope to have you on again.
Love to.
Yeah, terrific. All right, everybody. Thanks again for being with us this Sunday. Join us next Sunday again, same time, same place. And then next week we do have a game show going on. It's going to be Chris Kendall versus Nate Maris for the Raw Intuition game show. So definitely stay tuned for that. And thank you again. Until next time, always follow your raw intuition.